With the recent launch of the Ayushman Bharat Digital Mission, India is set to witness a transformational move that has the potential to take healthcare delivery in the country into a new phase of portable patient health records. This is the greatest opportunity to leverage digital health to build a resilient future. It is the onset of virtual, predictive, preventive care. The digital care delivery models are set to evolve around post pandemic patient expectations and regulatory imperatives. The Financial Express presents hashtag FE Digital Health Conclave 2021 that will discuss over the course of the next 2 days how Indian healthcare leaders are making a conscious choice of letting go of the unsustainable systems and are consolidating efforts to create newer healthcare success stories based on data driven, accessible, value based, predictive health models. The time for big change is here. Hello, everyone. I am Nikita Jain, your MC today for the event. But before we begin for the day, let us thank our sponsors who have graciously extended their support for the event. Presenting partner Optum Global Solutions India Private Limited, powered by Eka Care, co-powered by Navya Life Care, technology partner Cloudera, supporting partner Ecnamed, and associate partner Kefid. Thank you so much for being part of our journey. With this, it's time for the guest of honor note. Join me in welcoming our speaker, Sri Satyendra Jain, Minister of Health, Government of Delhi. Over to you, sir.
फाइनेंशियल एक्सप्रेस डिजिटल हेल्थ कॉन्क्लेव में आप सभी का स्वागत है। अभी जो हेल्थ केयर के अंदर जो मेजर चीज़ चल रही है वो है कि अब सब कुछ डिजिटाइज होने की ज़रूरत है। कंप्यूटराइजेशन, डिजिटाइजेशन बाकी काफ़ी फील्ड्स में हो चुका है। जैसे बैंकिंग है, बैंकिंग में आज से 20-30 साल पहले 100% डिजिटाइजेशन हो गया था, परंतु हेल्थ केयर के अंदर अभी भी काफ़ी पीछे हैं। अभी डॉक्टर के पास आप जाते हैं तो आपको पुराने प्रिस्क्रिप्शन लेके जाने होते हैं, रिपोर्ट्स की कॉपीज़ लेके जानी होती हैं। अब मुझे ऐसा लगता है समय आ गया कि हेल्थ के अंदर टोटल डिजिटाइजेशन होने की ज़रूरत है। दिल्ली सरकार इस क्षेत्र के अंदर दो बहुत ही महत्वपूर्ण कदम उठाने जा रही है। एक तो जितना भी दिल्ली का हेल्थ सिस्टम है उसको हेल्थ मैनेजमेंट इंफॉर्मेशन सिस्टम के थ्रू जोड़ा जा रहा है। हॉस्पिटल्स, पॉलीक्लिनिक्स, मोहल्ला क्लिनिक्स, फार्मेसीज, एवरीथिंग विल बी कनेक्टेड। पेशेंट डॉक्टर के पास जाएगा तो पेशेंट का सारा डिजिटल रिकॉर्ड, पुराना रिकॉर्ड डॉक्टर कभी भी देख सकते हैं और उसके लिए ग्राफिकल प्रेजेंटेशन भी होगी और कोई भी रिकॉर्ड मतलब एनालिसिस करना है वो भी सारा हो सकता है। और साथ ही साथ ये जो है कि हम टारगेट ये है कि इस साल के अंदर 2022 के अंदर हम पूरी दिल्ली के अंदर इसको ठीक से इम्प्लीमेंट करते हैं। दिल्ली के अंदर ये जो इनिशिएटिव है ये देश के अंदर सबसे पहले किया जा रहा है। साथ ही साथ हम दिल्ली के सभी नागरिकों का, जितने भी रेजिडेंट ऑफ दिल्ली हैं, सबका एक हेल्थ कार्ड बना रहे हैं। तो उससे क्या होगा, उसको आइडेंटिफाई करना बहुत आसान होगा कि उसका जो पर्सनल डाटा है, जो खास चीज़ हम करने जा रहे हैं कि उसका जो हेल्थ डाटा होगा वो उसकी पर्सनल प्रॉपर्टी होगी, वो सरकार की प्रॉपर्टी नहीं है। अगर वो चाहे तो अपना हेल्थ रिकॉर्ड कभी भी पासवर्ड होगा वो देख सकते हैं। किसी डॉक्टर से कंसल्ट करना है तो उसको पासवर्ड दे के दिखा सकते हैं। तो वो सबसे बड़ा एक चेंज करने जा रहे हैं कि जो हेल्थ रिकॉर्ड होगा वो उसकी उस पर ऑनरशिप जो होगी इंडिविजुअल की होगी। हॉस्पिटल में जो डॉक्टर हैं या हॉस्पिटल्स हैं उस डाटा को देख सकते हैं एट द टाइम ऑफ ट्रीटमेंट या उसको ज़रूरत है तब, अदरवाइज़ वो उसका डाटा उनके पास रहेगा। तो ये दो मेजर इनिशिएटिव दिल्ली सरकार करने जा रही है जिससे कि हेल्थ के अंदर रिवोल्यूशन होने की संभावना है कि बहुत ही आसानी होगी। आज क्या होता है कि पेशेंट खुद ही भूल जाता है कि पिछली बार कौन कौन सी दवाइयाँ ली थी। उस पेशेंट को याद नहीं रहता कि क्या क्या उसके पैरामीटर्स थे या बीमारियाँ थी। तो सबको एक साथ से देखा जा सकेगा और मुझे लगता है ये काफ़ी मील का पत्थर साबित होगी। धन्यवाद।
Thank you, Sri Satyendra Jain, for your valuable insights on the government's initiatives. For the inaugural address now, please join me in welcoming our speaker, Dr. R.S. Sharma, CEO, National Health Authority, Ministry of Health and Family Welfare, Government of India. Any summit on digital health would be incomplete without his views. Please, sir, over to you.
Thank you very much, Financial Express, for inviting me into your conclave and to deliver the special address in the inaugural session of the Digital Health Conclave, which you are having. And the topic which I see here is the digital health and its impact. And I'd like to share with you what we at the National Health Authority are doing, and what kind of vision we have of the digital health, of the digital technologies playing its role, their role in improving the quality, affordability, and access of digital of health service deliveries in this country. So that's what broadly I'm going to talk about. It's also very interesting that and actually we are lucky that the Honorable Prime Minister has launched the national rollout of the Ayushman Bharat Digital Health Mission, digital mission on 27th of September of this year, and I think we are now going full steam to implement what we think is going to be a very transformational effort. However, like every idea, the strength of that idea depends on how well it is implemented. So I think that is what we seek the support of everybody, including the press, and both digital press and the paper, sort of the newspapers, etc., to essentially propagate the message of this mission, so that everybody comes together and we as a country are able to realize the vision of providing quality and affordable healthcare to the people of this country. So let me begin where it all began. It began with the Digital India vision of our Honorable Prime Minister, wherein he said that we want to convert India, or we want to transform India into a digitally empowered society and a knowledge economy. And he provided us a vision of how Digital India will actually sort of be rolled out. And there were three layers of Digital India. One was the digital infrastructure, which is so much required for connectivity. Another was the software and services on demand. And the third was citizens empowerment. And this was launched as early as in 2014. And then we have continued to work in that direction. So on the first issue of providing digital connectivity, I think today we are much better, or much more connected than what we were about 7-8 years back. Today we have 1.18 billion mobile connections in this country. We have 700 million, more than 700 million internet connections. We have 600 million smartphones in India, and we have the cheapest data rate in the world. So basically, we are very beautifully connected. Almost every village has got 4G connectivity in this country, and the service providers, telecom service providers, has done an excellent job both in the public sector and private sector to provide that connectivity. India has created digital identity called Aadhaar, and today 1.3 billion people of this country have got Aadhaar. We have services which have been rolled out on top of Aadhaar, include the digital authentication services, and as many as 57 billion digital authentications have been done during the last 7-8 years that the authentication services have come into existence. Similarly, electronic KYC has been used based on Aadhaar, has been used to open bank accounts and to get mobile connections, and even to get other services included in other services. So, and similarly, we have digital locker, we have electronic consent artifact, we have digital signatures on demand. So there are many artifacts which have been created on top of digital identity, Aadhaar, which are what is popularly called the Digital India stack, or the India stack in the software journey. So I think that's the other part. We also have a huge spurt in the financial inclusion. Today, as many as 82% of India's adults have got bank account or wallet or some other instrument from where they can do financial transactions. So I think with all these, and you have the JAM Trinity, where you have the Janadhan, Aadhaar, and mobile. Janadhan is for financial inclusion, Aadhaar for financial address or identity and authentication, and mobile for communication. So I think this Trinity is doing wonders in the last so many years. So I think this whole vision of our Prime Minister of Digital India, which is transforming India into a digitally empowered society and knowledge economy. And some of the projects which we have done are quite unique, quite scalable, quite frugal, very much, very much robust technology and interoperable based on standards. Latest example I can give you is of COVID, whereby we have clocked 1.16 billion, vaccinations, and each vaccination is accounted for. So there's no fudging of figures. Everybody has got certificates, and today we are one of the few countries in the world which is issuing digital certificates after vaccination. So we have created a lot of these interoperable platforms of softwares which are delivering services in various areas. Now, what actually inspires this Ayushman Bharat digital mission is the success of all these artifacts, success of all these building blocks. So I think these building blocks are the ones which are going to enable the delivery of health services and using technology. So the whole idea is that we can create an interoperable platform which will be able to do service delivery. So first of all, we are creating a number of registries. Registries will be the vetted and verified sort of list of doctors, which is the health professionals registry, doctors, nurses, paramedical workers, Ayush and Ayush Vaidyas, and other Indian systems of medicine. So that's one part. Secondly, we are creating health facility registry, which means the hospitals, the Arogyasalas and other kinds of all Indian system of medicines registered kind of entities. And then we are going to create health, personal health records of the people. So we are creating applications where people will be able to store or fetch their personal health record, share it with the doctors. So this digital ecosystem is being built, and it uses many of these digital common artifacts. For example, video consultation. Now, digital consultation, which was called telemedicine in the past, now a better word probably for this is digital consultation, digital health consultation. So these digital health consultations will be enabled by seamless digital payments, by sharing of digital records, and of course by a great connectivity system which exists in our country. So I think we are all set to leverage these things. And what will this do? This will increase access. So for example, today somebody from remote part in Jharkhand, he has to travel all the way to Ranchi to get himself consulted, and then he can come back, or maybe district hospital. Tomorrow, if we use the digital consultation mechanism, then he can have video consultation and share with the doctor his health records, and doctor can give advice, give a prescription, and digitally signed prescription, which he can actually order medicines from even online if possible. Otherwise, he can buy it from the local pharmacy store. So that is the way it will basically increase the access. Similarly, because he does not have to travel down to Ranchi, and the doctor also does not have to physically go down, or physically he can also use his time better, the doctors. Therefore, it will reduce the cost. So cost of transportation of the patient, cost of the doctors, they can very well organize. Digital consultations are easy, in the sense that they can have diagnosis results, and they can see the sort of overall horizontal or longitudinal record of the patient. So probably provide a better advice. So that's the quality part. So it reduces the cost, and it improves the quality because of the access to better digital resources. Also, the doctors will have access to various AI systems, artificial intelligence systems, and other systems on the platform, where they can probably cross-check their diagnosis with the systems, with the artificial intelligence, machine learning kind of system. So that way, what we think is that the use of digital technologies in the health services delivery will improve the quality, will improve the access, will improve the affordability. And that's what we have embarked on. This mission is really what it is going to do. But at the same time, we should also be cognizant of the fact that this is not a government project per se. While the government will create platform, it is for the health service providers, both in the public and private sector, to leverage on this platform. Because if ultimately a majority of the health services delivery is done by private sector, and private sector has to actively participate in this mission to make it a success. And this obviously the participation both by the private sector and both by the patients will have to be voluntary. So what is going to happen is it's a voluntary system which basically will provide a win-win situation to everybody, including the patients, the doctors, the laboratories, the hospitals, everybody. So that is the play which is going to happen. So essentially, if you can, if I can give a sports analogy, the government is providing a playground, and now every player will actually play and then get advantage of this expansive and interoperable kind of playground where they can get information from. So I think that's where we are going. Once again, I want to thank you for inviting me to this conclave, and also I want to wish all the success to this very, very important and topical subject, because health, as you know, Corona has played havoc with the entire health systems and entire populations of the countries and the world, and therefore I think we are all trying to recover from that pandemic, and I think health has again become central focus of this entire sort of conversations in the societies.
Thank you, sir. It's highly exciting to be part of the digital health journey. Before we go on to our first panel, let us have a brief look at this opening video from Optum.
Health is an important part of life. It impacts relationships, careers, how we reach our goals and dreams. Managing our health should be simple and effective, with smart, seamless experiences that connect individuals to the right care and support. By drawing from broad data sets that create a foundation for deep, insightful analysis, applying experience and expertise to deliver care plans that improve health, providing personalized services targeted to the individual, addressing physical, mental, and financial needs, reducing costs and delivering healthier outcomes. By meeting each individual where they are in their healthcare journey, by helping them to know how to approach healthcare challenges, what issue to tackle first, and where to go for help, people are empowered to take ownership of their health. And good things happen. When the healthcare system is easier to navigate, barriers collapse and care becomes accessible. And as clinicians, employers, health plans, and individuals are guided toward the next best action, costs decline and results improve. At the forefront of personalized, connected healthcare is Optum, so people can focus on what matters most.
Up and onwards to our first panel discussion of the day. By the way, I'm hoping you all are sharing your learnings on social media using hashtag FE Digital Health Conclave, hashtag Financial Express, and also tagging us at the rate hashtag Digital Health Conclave. The COVID-19 era forced the need for digital prognosis and data-based healthcare solutions. The challenge is not just to deliver better clinical outcomes at an affordable price point, but also to go digital. Platforming and stitching the fragmented data sets could bring about higher accuracy in diagnosis and treatments. Let's explore more with our accomplished speakers. Please welcome Bhaskar Katmaneni, Commissioner Health and MD, National Health Mission, Department of Health and Welfare, Government of Andhra Pradesh. Neeraj Kumar Bhansar, IAS, Director of Directorate Health Services, Department of Health and Family Welfare, Government of Chhattisgarh. Swati Rangachari, Vice President and Country Leader, Public Affairs and Strategic Engagements, United Health Group. Amira Shah, Managing Director, Metropolis Healthcare Limited, and our moderator, E. Kumar Sharma, Deputy Editor, FE Digital, the Indian Express Group.
Hello, everyone. Welcome to a crucial session of the conclave looking at the various facets of the digital surge that is being embarked upon by all in the healthcare space in India. To discuss this, we are fortunate to have a distinguished panel. It will be nice if we can perhaps begin by each one of the panelists actually sharing some opening remarks, giving some perspectives in terms of how how each one views the way the landscape is emerging, the way they see in terms of this digital surge in healthcare, and what it means and what kind of opportunities and challenges is likely to throw up, and how they're kind of preparing themselves for this. May I begin with Ms. Sameera Shah? You've in the most crucial space of healthcare diagnostics. I think no medical treatment is possible without inputs on diagnostics, and I think 70% of all decisions would perhaps be based on what diagnostics reports say. How do you view this, and how are you trying to prepare yourself for times where integration of health records becomes so very critical?
Thank you, Kumarji. No, I think, as you absolutely rightly said, Metropolis has been at the forefront as COVID warriors in this entire fight in the COVID crisis. All healthcare services firms have been, and it's been a very, very challenging year for all government healthcare as well as private healthcare. We've all done our best to collaborate to really find a way to take care of Indians across the country. I think the move that we are going into with what COVID has brought, and digital health was in a very often sort of nascent stage, adolescent stage, and COVID has really pushed it forward from that perspective. And we're really talking about now a transformational leap into changing the way healthcare potentially operates in the pre-COVID era to now in the post-COVID era. And this is going to happen on multiple fronts. So while on one side, you have digital healthcare, health tech companies, which are trying to aggregate demand. But on the supply side, still things are extremely fragmented. Like you said, while 70% of decisions are based on diagnostics, but you'll be surprised to know there's estimated to be 150,000 labs across India. And the reason I say estimated, because we do not know the number of labs. There is no process today, a regulatory framework where you have to register to operate in the country. Now, if the registration methodology does not exist so far, you can imagine what happens to the rest of it. There is no governance framework across the country that puts a minimum standard to operate at this point of time. And therefore, we have seen a huge mushrooming of labs, which increases accessibility, but unfortunately reduces overall quality. And I think one of the things that's going to happen in the digital health era is that we hope that the government will use this opportunity to actually even put a regulatory framework to say who's allowed to operate in the new era. Secondly, how do we integrate the back-end systems of all the people who are operating? Because today, for example, out of these 150,000 labs, I'm estimating 140,000 would probably not even have computers. So the question is, in that situation, how are we going to integrate health records? Are there going to be softwares that are going to be allowing APIs and integration? Unlikely. And we're going to have to create the modalities for that to happen. Because if you want to show a patient their entire health history, whether they go to lab A or hospital B or public or private, finally there has to be a health ID, and there has to be all the data that connects into it seamlessly, where a patient is able to see their records from everywhere. We've seen Aadhaar become a success in terms of common identification. I genuinely hope the same thing happens for the health ID. I can see the government doing extensive work on the National Health Digital Mission and creating the health stack that's going to be necessary for this. But I do believe that for this problem to be solved and for all of us as Indians to go into this new era is going to require great collaboration between private and public sector in a very trusting manner. Because otherwise, as the private sector today takes care of almost 70% of patients in the country, but government has 70% of the infrastructure in the country. So if the two come together in a great way, I mean, amazing things can happen. And I think healthcare in India in the next 10 years is really in for a great opportunity to transform itself.
Very important. I think it's good that you touched the aspects of no entry barriers in diagnostics really, and this facet of governance, regulatory scaffolding, at least, if not a framework also, will be very crucial actually. So when we talk of a digital future, we need to link that in with it. Very true. I think all would be very keen to know in terms of how this transition to digital is taking place at the state level, which is very crucial. States have a very crucial role to play here. All would be keen to know what Mr. Bhaskar and Mr. Neeraj feel about the way forward in this and what they see as the opportunities and challenges. May I begin with Mr. Bhaskar, if you can share your thoughts on this?
Yeah, thank you. So I think this is quite a challenging time and at the same time quite exciting times for us in the health sector. So as you rightly said, COVID has actually made us go a little faster on this subject because of the issues of physical accessibility were there during the COVID times. So we had to move quickly to a digital platforms. So which I think to a large extent have happened in most of the states. When COVID started, we just didn't have any wherewithal to share information regarding COVID digitally. But quickly over a period of just I think 2 to 3 months, we could bring the entire management of COVID on a digital platform. At least I would be able to say for my state in Andhra Pradesh, entire COVID management from the time a person has symptoms is tested to his contacts are traced to his admission in hospital to his discharge and his treatment management, everything has been digitized. So a large amount of data has been created. But at the same time, we found that earlier also a large number of digital systems were put in place, but they were all working in silos. So these databases would not speak to each other. And then parallelly, the government of India had come up with Ayushman Bharat Digital Mission, which was like the plugging gap kind of a thing in which all these databases can be brought together if there was a common denominator, which we didn't have. Other could have been used, but other had some limitations because of certain legal issues and all. Now, under the Digital Health Mission, Digital Health ID is being created. I'm happy to inform that our state has been at the forefront. So we are not waiting for the citizens to voluntarily register themselves and get a digital health ID. Of course, that portion is already available, but we do it in a different way, unlike any other state in India, that we actually go home to home. So there has been one work under national action on the communicable diseases and non-communicable diseases, under which every citizen of the state, basically their health parameters, their demographic parameters are being collected. That we are doing. And apart from doing that, we have also clubbed this work of creating a digital health ID for them. So we go each house. We do the diagnostic tests there itself. So we collect blood samples, we collect other parameters for the citizens, and then the data is collected. And the digital health ID is also generated at the spot, duly taking the consent of the citizen.
Yeah.
So, and then the moment it is done, we have built a robust system where the existing databases automatically sync with this data because now there is a common denominator. So we are building that database in that way. I'm happy to inform that in the next 6 months, the entire 5.5 crore population of this state will be having a digital health ID. So apart from the citizen having a digital health ID, there are two other components where the medical professionals have to also be registered, everybody. And the hospitals have to be registered. I'm happy to inform that all government hospitals in the state, be it the smallest village level clinic, which we call a subcenter, to the largest teaching hospital with 1,000 beds, each of the hospital is already into the digital health mission with them registered. Now we are doing the health professional registry, and I can assure you that in the next 1 week's time, all the health professionals in the state would also be there in the system. And around about, we have started slow. We are creating around about 40 to 50,000 digital health IDs every day. We intend to scale up to almost 5 to 6 lakhs a day, and we expect that in 5 months' time, every citizen will have his digital health ID done. And our in-house hospital management system is already working in many hospitals in which we are seeding this digital health ID data, and these databases will be speaking to each other.
Thanks so much for such a exhaustive, detailed explanation of what you've done and will be doing. Neeraj ji, can you compete with Mr. Bhaskar on what he has achieved? What would you say in terms of the kind of roadmap that he has laid out and the distance traversed, what would your sense be in terms of data being able to talk to the various platforms, being able to talk to each other, and the health ID and all of that? What's your sense in terms of where you see the roadblocks in this journey and the opportunities?
Thank you. Chhattisgarh as a state it's actually making a lot of progress in terms of this digital healthcare. Like Mr. Bhaskar told, we are also on a course of adopting Ayushman Bharat Digital Mission. And the 3 and 4 important pillars of Ayushman Bharat Digital Mission is the registration of the healthcare professionals, making of digital health IDs, and registering all the hospitals. So these are the important, and bringing in all the different verticals, health, especially the Department of Health and Family Welfare is like it is divided into different verticals. Now all verticals, they work in silos. The Ayushman Bharat Digital Mission is one of the important ways in which these verticals are actually integrated together. It was a long time due which was needed, especially in case of health, and it was all the more realized to be done as quickly as possible, especially into the circumstances of the COVID pandemic management.
If you were to pick one or two, Ms. Neeraj, if you were to pick 1 or 2 areas where actually you think that you are making progress, and 1 or 2 challenges that you're seeing in this journey, I mean, very briefly, if you can just touch upon that, it might help other states wanting to embark on this journey with you.
Chhattisgarh, then, if it comes to COVID, like we had successfully managed lakhs of home isolation patients. We used not only the telemedicine platform as provided by this Government of India, the Sanjeevani. Apart from that, we had also developed our own monitoring systems in which we monitor over lakhs of patients. And apart from that, we had built some in-house systems to basically reach to the ground. The ANMs and the ASHA workers known as Mitanins, they were having the apps over their phone. Whenever they used to go to the field, their home isolation patients, especially the rural areas patients which were actually not accessible, they were, for them, the first point of contact becomes the ANM or the ASHA worker, Mitanins, basically known as Mitanins in Chhattisgarh. So now when they approach them, when the patients come into contact, the persons come into contact with these ASHA workers or ANMs, now they are the main repository of the information that if depending on the symptoms, where would they be needing hospitals, hospital admission, or they can be treated at the home. So they will be disposing the medicines, right. And then if the transportation is required, they will be the source who will be contacting the referral transport either through 108 or whatever transportation is available. So these were 2 important these things. Apart from that, when it comes to the implementation of a different sort of like Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Chhattisgarh has made the highest number of Ayushman cards, that too in the time of pandemic. Chhattisgarh was at one point of time, we used to create almost like 5 to 6 lakh Ayushman cards per day, which was never like when the entire country used to make like 10 lakhs card. Out of that, Chhattisgarh used to be the highest, like 6 lakh cards. That's and on an average, we used to make 2 lakhs card per day. And over a period of 3 to 6 months, during the Ayushman card, Aapke Dwara Ayushman Abhiyan drive, Chhattisgarh was able to make more than 1 crore cards. And right now, Chhattisgarh has almost 90% family, 95% family has at least 1 Ayushman card in their household. And whereas roughly 60% of the family, they have so about 50% of the persons in the Chhattisgarh entire state, they have Ayushman card with them. So this is this has been a huge challenge and work which was done in Chhattisgarh during the time.
We'll come back to you actually on this. May I get in, Ms. Swati? So, you come in from given United Health and Optum. You come with a global perspective, be it out of key markets like US and Europe and elsewhere. You've heard various panelists talk about the various things that they are attempting and wanting to do. Could you tell us briefly about your organization and some, the way you see your, insights you would be able to, pitch in this crucial transformation of this healthcare in India as we see it?
Thanks, Kumar. And I'm very glad to be a part of this panel. It's also very educative, and at the same time, it helps us as a company see areas that we can actually deliver value. So the United Health Group is a Fortune 5 company, has got, healthcare is in our DNA. We have the United Health Insurance, which is, right across the US and other countries. Of course, in healthcare insurance, the payer side, and on the provisioning or the provider side also, we are very, very closely associated with the entire ecosystem from hospitals, primary healthcare, and otherwise. In addition, through Optum, we also, do a lot of work around the digitization of this entire ecosystem at the breadth of it, and also at the depth of maybe hospital management. I heard one of the gentlemen speak about that, to pretty much all aspects of where all digital can play a role in bringing in efficiency and effectiveness. So when as a company, when we see India embarking on this exceedingly important journey, first of all, commendable, because I've gone through the Ayushman Bharat Digital Mission, and I'm very, the framework is very well articulated, and the phases and platforms, as they call it, the building blocks are very well established. Of course, it all comes down to implementation, right? And if India is successful in this, it's going to become quite a case study to the world, because in many parts of the world, such an ambitious ecosystem has, of course, in different times has failed. And therefore, we can learn from the world's failures as we learn from the world's successes. But let me actually concentrate on what is relevant here. Ayushman Bharat Digital Mission has come at an opportune time of COVID, where even the citizens, the industry, and the government have woken up to the most important and central asset of healthcare. And I think now that the intent to work together is exceedingly strong. The downfall of healthcare is massive socioeconomic impact across, and so it is in everybody's vested interest that the Ayushman Bharat Digital Mission actually becomes a huge success. What Andhra Pradesh and Chhattisgarh is doing, and for that matter, other states, it's really amazing in terms of how you're operationalizing, the ABDM. And I'd like to just call upon certain areas that becomes very important for the seamlessness of this entire system is the registry and the standards. What I liked about the Ayushman Bharat Health Mission, the digital mission, is having the registry and standards at the cloud level, at a central level, which is going to be more of a plug and play. That gives it solves for a very important area, that is scale. And it also solves for an important area, that is the diverse ecosystems that can actually come and plug into the system. So if this framework is well established with well-articulated operationalizing of these registries and standards that are uniform right across, and has a flexibility of bringing in more change, this would actually help. And I would, in fact, I'm sure it's happening, by the way. I shouldn't be, putting it in any other way, but to say that if the center and the state work very closely together, then India as a nation become a huge community and a body of a successful digital healthcare system. And I would believe that this actually can be a kind of a reverse innovation to other parts of the world. We have a lot of experience in all the verticals of the ecosystem and also the entire framework together. So we'll be very happy to work very closely with the government and see how we can, help and support in making this a success.
Excellent. I think that's very important. I think crucially needed at this juncture, as everyone wants to do the best. Ms. Ameera, I have a couple of points. I think you need to, everyone has talked about what is it that they have been doing. If some sense you can throw some light on, when this talking of this integration with the physician, whether in terms of, looking at this whole lab information systems, looking in terms of some of the steps that you have taken, how you've tried to move ahead in this journey, if you can throw some light on that. And from a diagnostics perspective, the mature entities, at least, which are there, while we talked about the unregulated and then the huge space that we have given the low entry barriers in this space, some steps that you as a leading player in this space have taken, some of the challenges that you've faced and what you see going forward. And to that, I would want also, if it would be nice if you can also refer to an aspect which you referred to earlier, also in terms of patient health history. So unfortunately, that often gets missed and is very crucial. How are you trying to address this problem? Say, how long should the patient history be? 5 years, 7 years? How are you trying to approach that? So broadly, these some points, and please take your time and explain whatever you should.
Sure. So I think if we understand how brick and mortar healthcare works in the non-traditional space in healthcare, is that usually in the patient gets sick, they go to a doctor. Doctor writes a prescription for diagnostics. Patient then goes to the diagnostic center, gets the results all in paper. Then that patient takes those results, goes back to the doctor, does consultations, then they get a prescription for medication, they go back to a pharmacy. And often there are many other steps in the way. Sometimes if they have to get an X-ray or they have to get something else done. So I think from the patient perspective, there is a lot of coordination they have to do. They have to go to multiple different locations to get different pieces of information, which makes it challenging when they're going through a healthcare crisis at home. They also never have a single window view of what's happening because, as you know, multiple people give you different data and they don't all match. Something simple you see if it is where a diabetic patient who comes to a diagnostic center like ours will get a reference range, which we have made for Indians based on global standards. But probably if they go to another lab, any other, even if it's organized or unorganized, they'll get a different reference range. Now, how do you as a patient even compare the two? How does this show up in your charts for you to monitor your sugar levels? Something as basic as that is something which is today missing completely in the healthcare system, whether it is private or whether it is public.
One more point about the patient history, if you can just say in terms of, how to, what's your thought there? What are you doing? And how much back in history do we go when it comes to recording the patient history?
See, we have data going back, I would say 10 years, 10 to 15 years, in multiple different
Have it currently stored, 10 to 15 years? Yeah,
currently stored. But
a patient who has come 10 years ago, he'll have your data in Metropolis.
We have the data in Metropolis. But today, we don't have an easy way. For example, if a patient goes onto our website, I would ideally like that a patient can access their data of 15 years ago in a systemic monitored format just on our website or our app. But today we don't have that ability. But if a patient writes to us and says, please give me my records, I can give it to you. No problem at all, right? For last 15 years. So that's still there. But what you want to do is make it easy also for the patient, because every patient cannot write to you and say, I want it. Now, honestly, this is going to be the hardest part, because in the past, all of us have not had technologies that allow for the seamless transfer of data into the formats that are currently working. So I think this is going to be, not that it's not a solvable issue, it's going to be like a Y2K issue, if you ask me. It's going to require great resources put at one time towards a certain problem and say that, look, we have to solve this from a tech. Either there's going to have to be an incentivization given to consumers to put their past data records onto some sort of a central superhighway, or there has to be an incentivization or a push given to providers to put all the past data. But I think past data is going to be a humongous challenge. And therefore, I think the only thing that's going to work is going to have to be market forces and ease of technology and tools that allow healthcare providers to be able to actually try to put that data, because even if people want to, they may not have the ability to do so. So I think in a lot of ways, we may have to start from a clean slate now, going forward, rather than so much in the back retrospectively. I think that's going to be a big challenge.
So I'll just take a minute and come back to you on this, and then we begin the concluding remarks. Really, I want to get in the people from the government about what is it that they see as the priorities and what you mentioned. But before that, a concluding remark actually from Ms. Ameera about what you see as, from the discussion that we have had, from your perspective and the way you've looked at diagnostics when we embark on this journey. What would your takeaway be for the listeners who are listening in and want to understand in terms of, the way we are seeing the key roadblocks and the immediate priorities for the diagnostics players actually?
I think health being more of a state subject, we have always seen that progressive states have done a lot of things in healthcare. And I think those states stand out in India. And there are unfortunately many states where things don't move as fast. For players like us, which are pan-India, and also working with state governments and also with central governments, this sometimes becomes a bit of a challenge for private players, because some governments are moving at different paces, state governments, than others. And therefore, the things that we are able to do in our technology or in our adoption are very different state to state. We saw this actually play out in a very high manner during COVID. There were some states which were far more disciplined about the locking and the unlocking. There were some states which were more casual about it. And the rules were different in every state and every municipal corporation as well, even when it came to COVID testing. So I think the only urge I would say from the private sector in general is only that I think having a healthcare frameworks and some of the rules be more common and standardized across the country allows for the formal organized sector to actually operate in a similar way across the country, versus what happens today, which is very, very unique and different state to state, which works well for the state, but sometimes for pan-India players becomes a big challenge to actually operate in that situation. I think the second thing is, like I mentioned, I would really urge the government and private sector together to come together and try to find a way to solve some of these issues around the quality and the minimum standards piece, because I think that's very, very critical. And if we ignore that piece now into this new digital health era, we are going to be continuing the same problems of the past into the future, but in a different way. So I think that is something that definitely we need to address. That is not a bad word. And I think if as long as we are doing good work and as long as we are taking care of people's health in the right manner, then I believe that coming together can really be much more transformational. And I think bridging that gap can help Indian citizens more than anybody else.
Thank you. I think that's well put, and I think, and there is much to, there's enough food for thought there actually, though I think it's a challenge in itself, but I think it's a good thought to actually pursue further. So thanks so very much for your time. I need to go back to our Mr. Neeraj and Mr. Bhaskar about what they see as your priorities. If you could just share some thoughts on what your immediate priority, I know you've covered some distance, what your priorities are at the moment, and then final concluding remarks in terms of what you see as the way forward for you. And then finally, I will come after both of them to Ms. Swati on her concluding remarks. Mr. Bhaskar.
Yeah, thank you. Having heard the other speakers, I find that there's a gap in basic understanding of what the Ayushman Bharat Digital Mission is about. So whatever concerns have been raised, more or less, most of them have been addressed. See, the Ayushman Bharat Digital Mission doesn't have a central database. It doesn't. It just has that backbone where it would be networked in such a way that the data flows between the different systems. It doesn't stay in any central depository. It doesn't. So, for example, I'll take example. If, say, a organization like Medanta has its own IT infrastructure, has been using digital systems and has its digital data, that will remain with that organization. That will not flow into any central database. Similarly, within the government sector also, any government hospital, say the lowest primary health center also, if it generates any digital data, it will remain with that small PHC only. this data is not going to go to anywhere else. When we access the data, I am accessing the data from all the resources in which this citizen's health ID has been associated. Say if I sit in my PHC and a patient comes to me, and of course with the consent of the citizen, there is a consent element built into the system. See, even if I want, I can't access the data without the consent of the citizen. With his consent, when I access the data, I would be able to access the data of that citizen everywhere from all sources. He would have gone to some private hospital, he would have gone to some government hospital, he would have gone to some diagnostic center in government, private, or a pharmacy, government or private. I would be able to access that data if I am logging into the system. So that is the first thing. There is no central database for anybody to really worry about. Second thing, there were some concerns saying that, would it work in India? We have a big, Aadhaar. I don't think any other country has Aadhaar. Even the US doesn't have such kind of a infrastructure built in. And UPI, I don't think any other country has kind of UPI that we have. We somehow, I think, underestimate our capacities. And Aadhaar has happened in this country, the same country with the same kind of poor bandwidth, internet connectivity, whatever problems we say with the same kind of public sector that we have. I think Aadhaar was done by the public sector.
How do we incorporate when we embark on this journey, when we talk of smaller players in the private? Not everyone in the private is a 5-star. So how do we incorporate, get a smaller players to, finance this journey, so to say, so there are, and when we talk of various states, then how do actually platforms talk to each other? You referred to some problems in terms of, the way that is being attempted by your government. Very briefly, what would your immediate priority be? Could you indicate that in your various things that you want to unfold in the coming year or so? Very briefly, what you see as your immediate priority?
For the government sector, the problem is simple. Without physical infrastructure, talking about a digital interface and digital infrastructure is really, you're going in the wrong way. I need to have a facility, I need to have a proper HR, proper doctor, trained, and equipment available. That's the main concern that we have today. Yeah. Without addressing that concern, not having enough doctors available, enough paramedics available, enough staff nurse available, we're just talking about digital health and all that will only take us a little far. It is not going to take us really the long way.
To be leveraged, that's what it is.
Yeah. So we need to have a system where the private sector is also mandatorily made part of the digital health mission.
Right. Thanks. Ms. Swati, you wanted to interview, you wanted to say, I want to just have concluding remarks.
Concluding remarks, and Bhaskar ji, just wanted to first cover a couple of things. What I wanted to share is that because of the success of Aadhaar and UPI, and for that matter, the whole JAM platform, all I'm saying is that the world is looking at India very differently right now, including COVID, right? The way we spread out the whole vaccination program in extremely challenging circumstances. So India is now coming to be known for its flexibility as far as programs are concerned, and also building out the robustness. What I'm saying is that when countries have, embarked upon this journey, perhaps because of their legacy and not a very well thought through plan, I have no idea. Some countries have not been able to make it the success that it should have achieved. And I do believe that India's success in this space, given our journey of successes, India's success in this would be a huge landmark for other countries also who can imbibe this framework to what they are doing, right? So I think where I'm coming from is that it becomes very important that, all of us work together towards this. And I can tell you that the private sector, at least a few of us are very eager to contribute, because a healthy ecosystem and a successful one in India is going to actually bring value to the world. And we see it happening because we are not just an Indian player, we're a global player. And we want really to see this reverse innovation happen. In addition to that, I agree that physical infrastructure is very important for a digital infrastructure or digital highways to actually play out. And many, and I'm sure you're already aware of it, but the whole hub and spoke model of hospitals to primary healthcare, more training for nurses, and a far bigger bench of nurses trained in various aspects. And we are again in a space where we can support as far as training is concerned. I feel these things would really help out with really concentrating more on primary healthcare and then, looking backwards from there. Many countries are recognizing that, multi-speciality has a space, but more concentration on the primary healthcare would really help in panning out the resources more effectively right across that. I'm speaking to the choir. You're far more an expert in the space that you are in. But I can tell you that we are very happy to bring our best experts from across the world and in India to help support India's journey.
So thanks so much.
Hey, can I just, Kumar, I just wanted to bring across 3 points, very, very crisp. See, the healthcare is anyway universal. Right? So the 4 critical pillars, which I'm really happy to see the Ayushman Bharat Digital Mission also kind of cover. But if we can start to, and I'm not sure where your thoughts on this, Mr. Bhaskar, but it's really important that we are able to start mapping or program managing the journey of India's digital healthcare success as we are panning it out. So because it's going to become a case study to the world. So, how do we enable the clinician for better diagnosis being a very important pillar, lowering the cost being a very important pillar through administrative cost systems and everything. And therefore, we can invest more in digital healthcare so that we can reduce administrative costs, improving access, like you're saying, smaller primary healthcare and good access through digital healthcare, telemedicine, and so many other things, and also improving outcomes where instead of looking at systemic diagnosis in healthcare, look at a more holistic, like autoimmune diseases and all that. As a child, I might have had some issues which would actually become very important in terms of mapping that to a current problem that I have. And this is something that we do so well in Ayurveda, actually, and we should imbibe it in various aspects of our medical practices, and that comes from the way we capture healthcare data. So I just wanted to share that these 4 pillars and the way we, capture the success of these 4 pillars would also perhaps help. It's a little more work, but I think it is really important.
Thank you to all our panelists for your insights. They were enlightening. Before we go on to our next panel discussion, let's have a brief video from our sponsor, Cloudera.
Have you ever wondered how we sequence the human genome? Or how we'll send humans to Mars? Well, at Cloudera, we believe that data can make what is impossible today possible tomorrow. Cloudera.
Let's now move ahead to our next panel discussion. The need for connected health were perceptibly displayed during the recent COVID-19 wave. It became a necessity, particularly for those with chronic or emerging serious diseases. Looking at India's demography, it would be a humongous task. So let's see and hear what the panelists' opinion on the same are. Welcoming Sunil Kumar, Deputy Director General, National Informatics Center, Government of India; Chandramouli, Technology Advisor, Sankara Netralaya; Dr. J. Ramesh, State Nodal Officer, ABDM, Department of Health and Family Welfare Services, Government of Pondicherry. Our moderator is Dr. Sandeep Sharma, Managing Director, Deloitte. Over to you.
Hi, everyone. We heard, I think, few years back, all company is technology company. But we really know that this technology brings many industry or many companies to our home. I think from the last 1.5 years or 2 years, right? Our home became office, our home became schools, and our home became partial hospitals or doctors' clinic also, right? And we are going to discuss on this topic that how our home became doctor's clinic in last 1.5 years, and how basically connected healthcare or digital healthcare, we can name anything, right? Stepped in our home and in big way. And data speaks. So I just want to quote a few numbers here before starting our discussion, that before pandemic, our telehealth consulting in India was $26 million. But within 1 year, it basically gone up from $26 million to $163 million, which is 600% growth. And we are seeing 72% growth year on year. And I'm only just talking about a very small portion, which is teleconsulting with doctors. I'm not talking about any other things. So that's the interesting, I will say, disruption or change happened in the digital healthcare, or we can say that the connected healthcare. So my first question to all panelists is, how connected healthcare helped in pandemic? What is your experience? And it will be great if you will share any examples. So I will start with Chandramouli sir.
Yeah, thanks. See, I'll just recall the day the pandemic really struck. Actually, we were all clueless about what to do next. In fact, perhaps for the first time in the decade, probably, we shut down an hospital for quite some time because for lack of standardized protocols. But what we quickly realized is that we need to reach out to patients. Although we were the pioneers in the telemedicine in the country, we established our telemedicine. We were the first, our chairman was the first telemedicine Society of India's first chairman, actually. So we were literally caught by surprise that this demand had to be met overnight, actually. So we quickly put together a technology which can really change or rather touch human lives in a shorter span of time, which we already had, but we had to tweak it to the pandemic needs. In less than 2 weeks, I think now we quickly put together a whole program which can really help our patients to connect with the hospitals. We have close to around 8,000 patients whom had been operated upon, on whom we could not reach out to them because of the pandemic, and they couldn't come back to the hospital. So this came in really handy. And all of our doctors have to be completely go offline or rather work from homes to really counsel the patients. I think that was the first time we could see a transformation upscale that we couldn't really assume that could have been done over the previous decade, actually. I think from a hindsight, I think it was a welcome change. But we also realized that telemedicine itself is not a panacea for cure. And because of all the lockdowns and so many other things that happened, that many patients couldn't really connect to our hospital, because this is a specialty which requires a lot of digital equipments, which require you to take images of eye and so many other things for you to really make decisions. So we really partnered, we established a value extended network through our partner clinics, through Titan Eye, to put in some specialty digital solutions and extend our cloud solutions where we can really have a comprehensive eye examination done and really reach out to connected to various people. I think that was the biggest change that I can really see. I think we can really go on and on for many of these things, but telemedicine, like you said, is one such example where we had already made a big presence, and it has already benefited around 15,000 patients in the last 17 months or so since the post-pandemic launch, I will definitely say. And I just wanted to bring out one other striking feature. When we did a study around 4 or 5 years ago, we realized that patients spend 6 times more on a visit to Shankara Nethralaya than what they may be spending on Shankara Nethralaya. If I were to take one example of, say, assuming that somebody is going to spend around 1,000 rupees at Shankara Nethralaya for a normal eye checkup, for example, they should have been spent at least around 6,000 rupees more to come to Shankara Nethralaya, get quality care, go around, come back, and things like that. And if I were to translate a rupee number, that what we have connected what we have really saved to the patient community at large from Shankara Nethralaya alone, it is astounding 9 crore rupees in the last 15 months for our patient community. I think the impact that technology can create or a connected care can create is enormous. And there are many such examples actually. So this is one such example where we not only transformed an eye care from a high touch to a high tech, but also created a lot of savings potentially to the patient on simple OPD. But our goal is to disrupt the OPD itself. We'll talk about it down the line. Yeah.
And Dr. Ramesh, you want to go next?
Yeah. Good morning, everybody. Talk about the connected healthcare and digital healthcare. I find a small difference between both the terminology. Now, for the first time, the pandemic started early last year, 2020, which brought to the focus the need for connected healthcare. This refers to all the type of interactions which at administrative level, being a government employee and representing the government of Pondicherry, we found that connectivity is required not only in health for managing a pandemic, it goes beyond the health department. What we saw was for the first time, people had to remain at homes, as my predecessor said. They cannot go to the offices, they cannot go to the schools, they cannot reach the hospitals, they cannot reach healthcare. So we have the elderly and comorbid who have to undergo what is called reverse quarantine. They have to stay at home to ensure they do not get COVID infection. And we have to manage things called home isolation. For those who are mildly symptomatic, they have to stay for 14 days at home. And therefore, healthcare should still be delivered to them. We have to manage what is called quarantine, the contacts of all those COVID positives who have to stay at home and still they should be monitored. And you have to handle what is called shifting all these patients, whether they are in quarantine or in home isolation, when they become sick, to the health institutions for COVID care. So multitude of jobs. So this involves not only the health department, but also enforcement departments like the revenue department and the police department for to ensure quarantine. Because a pandemic is one in which we have to ensure that all the rules are followed for public safety. It's a public health problem. Individual rights go below and public health supersedes individual health and individual rights. So here, we had a lot of opportunities in UT of Pondicherry to implement the Ministry of Health guidelines. Most important of all, when we talk about digital health, we talk about telemedicine. Even before that, all of us have been using WhatsApp. WhatsApp came in a big way at a healthcare level. Then we formed teams with a medical officer, with a revenue official and police official. They are in touch with each other, and daily we have a COVID positivity list. This team gets into action. We identify the people who are at home. We created an IVRS system for reaching out to these people. We trained NGOs as counselors and students as counselors, wherein we participated. A voluntary organization called Step One was involved, in which we created an IVRS system. We will send calls, first call, automated call, to the individual who is sitting at home, who has turned COVID positive. After all, if you're COVID positive, you cannot reach the hospital. You're breaking the social distancing. You take an auto or a car and you bring the disease to another person, people to come out of the homes. So the IVRS has standard set of questions. Do you have cough? Do you have fever? What is your SpO2? So we decide whether he needs a visit by a medical team to his hospital office, to his home or not. That is the first point. If the first IVRS call is not returned, we send another IVRS call within 2 hours, automated. If that is also not replied, the third call goes by evening 3 p.m. If all the 3 calls are not replied, then our team visits there and assesses the situation, health condition of the patient. This way, one of the important problems in a COVID, that is prevention of spread in the community, which arises out of the patient traveling to the hospital itself, was taken care of. We used connected health here. So also WhatsApp groups with police and revenue helped in ensuring quarantine. It's human nature to break rules. I cannot sit at home just because I'm a contact of a COVID positive patient, just because the government says so. So we use the revenue and the police to ensure this happens. So we have the list, they ensure that these people stay indoors. So also at administrative level, a lot of education. My predecessor and Mr. Sandeep talked about education, how education reached online to students, be it higher secondary, primary education or college students at home. Think about educating all the healthcare workers about the COVID protocols. Government of India came out with an iGot portal using Diksha, and we have all tele education facilities for all healthcare workers, starting from our lowest level, ANMs and ASHA workers, Anganwadi workers, going up to the super specialty level, the anesthesiologist, the intensive care physician, what he is supposed to know, what he is not supposed to do. So we have iGot training, education. This is largely possible because of connected healthcare. We have all platforms available now, about which many of us did not know in 2019. You call it Google Meet, you call Microsoft Teams, you call it Zoom Meet as we are having it now, or you call it webinars and WebEx meetings. So this has become a child's play now. This helped us great way for higher level hierarchy in administration to pass on messages, not a hospital visit, but also on official and medical meetings and medical association meetings have become less costly now. So education goes out very well because of this connectivity, and we are able to transmit our data. Pondicherry is peculiar in having 4 districts which are far distributed from each other. One is Yanam, which is near Andhra Pradesh. One is Mahe, bordering Kerala. One is Karaikal, down south in Tamil Nadu, and one is Puducherry. So it was very easy for us to transmit data to our administrators, to our doctors, to the various revenue officials, collectors, what we need to do by having various meetings, daily transmission of data. And our home monitoring was very useful for us, because we were using this IVR system by creating COVID war room. So we had a COVID war room wherein technology was used to the maximum, and we ensured all the people who were tested positive remained at home. They were taken care of at home, and they were shifted in a timely manner if they became sick by a visit by the hospital team and shifting to the hospitals. Early on in the pandemic, being a place where health is available well, we had almost 7 private colleges, and government institutions give 100% free health in UT of Puducherry, being a small UT under direct control of Government of India. We are able to bring them in for ensuring COVID care to the maximum.
Thanks, Dr. Ramesh. Yeah, thanks, Dr. Ramesh. This is really great examples, and especially.
And one word about telemedicine, if you can permit me. Telemedicine and teleconsultation has got a definite role. It helped in reaching out the elderly and diabetics and looking after the problems. But let us understand situations in intensive care. A doctor's visit is essential to assess a patient's condition. So this is one of the issues which we have to deal with. Telemedicine and teleconsultation cannot be applied uniformly in all settings. However, it helps in preliminary care and helps in a pandemic situation.
Thanks, Dr. Ramesh. Great examples. And I want to know the opinion of Mr. Sunil. What do you think on this question?
Basically, NIC is a technology company.
Yeah.
So during this period, COVID-19 period, we realized that we cannot implement or develop silo systems until unless the systems developed by different agencies, they are connected, services to the public cannot be improved. So let me give some examples how this connected health through technology has helped in improvement of the services. So the first example is basically we have a module, a software called COVID-19 portal, which is used by almost all the states. And we cannot monitor any COVID-19 patient until unless we start from the sample taking process. So there is a software, there is a mobile app called RT-PCR sample collection mobile app. So we collect the data and we collect the sample. It goes to ICMR labs. So there is another system from ICMR which takes care of lab and its functioning. So sample is collected using RT-PCR app and results are fed by ICMR, another software. So both of them were connected. Now, when the patient is found positive, then the data is to be monitored by respective state government, respective district administration, and by respective health facilities. We have silo systems, but there is a definite data connection, data integration, and data exchange between the system. So what is the value in it? The value is basically the data is correct. So single source of truth is attached to the data related to COVID-19 patient. So that source of the data is owned by ICMR. It means they are confirming that this data has been, this particular patient is basically, so private labs, whether they were also testing, so they have their own software. So they were also brought they were onboarded onto ICMR software. So the role of NIC and other and the government agencies was to integrate. So they were a lot of development happened at different places. And this is one example. Another example is basically if you look at that CoWIN. So CoWIN, when you go for registration, it is directly connected with Aadhaar. So this is where the role of NIC using AUA of Aadhaar was playing a very crucial role in that, while authentication of the.
Yeah, Mr. Sunil, this is great example. And basically, to be honest, we can show the world that this 1.4 billion basically population of the country, right? How we handled this, where we have one example with the connected healthcare, we saved 15 crore rupees. Second, public health service is greater than your private rights, individual rights, right? And third is availability of information by single version of truth.
Yes.
How whole India basically became a one India, and we basically fight this battle. So it's a great example. I wanted to move to the next question. 65% India lives in villages. We have our own challenges in villages. So I want to know your opinion, Mr. Sunil, that what are the challenges you are seeing in India when basically we will take this healthcare, right, connected healthcare to our villages?
One of the major challenge which we are facing, because we have gone up to the village level, because we are interacting with Ashas, ANM and Anganwadi workers. When we give handheld devices or say any say mobile or tab to these functionaries, so one of the major challenges is connectivity. Although it has improved a lot, and that is why we are able to implement various IT applications and monitor the data effectively because of improvement in the. But still, we are facing challenges in internet connectivity. So if that improves, so and another other is basically our systems. We don't design scalable system, but CoWIN and Arogya Setu, these are the two systems which has shown us the path. Now we are more and more enlightened technically how India can develop applications which are scalable in nature. That it doesn't mean these applications we were not developing. We were developing the software, but they were not scalable by design. So we don't design the system that way. Now we have been enlightened. Now we are this enlightenment has come during this COVID-19 period. It is an opportunity, and now whatever system we are designing, they are scalable by design. They are security by design, because health is a sensitive matter. Apart from this, UI UX has improved a lot.
Yeah.
Because real interaction with the public, real interaction with the health functionaries at the lowest level has to go. So it has to be very, very simple. Their experience with the IT application, that should improve, and there should be a consistent and simple experience and very small input and large output out of it. So that is what we have.
No, you are absolutely right, Mr. Sunil. And as a architect and as a data scientist, I really salute these software development and applications development within no time, because creating these kind of system, or basically I will say the whole ecosystem, it's not a one system.
It's ecosystem. Yes.
Right. And developing this whole ecosystem with accuracy, efficiency, with the time foundation limitation is, I can say that only happen in India. So same, basically on the same question, Dr. J. Ramesh, you have any opinion on this? That how we can, are you seeing any challenges in India when we will take it to the village?
Yeah, being part of ABDM, Ayushman Bharat Digital Mission, one of the concepts in creating the various platforms include creating health IDs for all citizens of India. The second component, as we see, is registering all the health facilities, and third is registering all the doctors in India. Once all this integration is done, as was pointed out by the NIC person earlier, Dr. Sunil Kumar, the important things which come is integration of health data of the individual to his health ID. Okay. All said and done, in Pondicherry, as a pilot project, after the Prime Minister announced it in Independence Day on 2020, we launched this process, and right now we have completed enumerating around 5,76,000 health IDs for the population of Puducherry. This has crossed 50%. Our total population is around 12 lakhs. We are able to do it. Similarly, all the health facilities in the government sector also we have integrated. The point is about the internet connectivity in the remote villages where creating these health IDs becomes difficult. This we circumvented by calling the individuals and citizens to the nearest PHC, creating an internet connectivity and creating the health ID. Okay, so far as creating health IDs is fine. At an implementational level, for our digital platforms to be successful and our digitization to take up in a big way, this should be uniform all over India. Our infrastructure with respect to connectivity needs a lot of scope for improvement in India. We realize that the sooner we go towards that, we will be able to integrate all this, and then only the real advantage of this National Health Digital Mission will be there for the people to enjoy. Think about traveling to Jammu and Kashmir, developing a medical illness there, and contacting a health facility which is registered in the Ayushman Bharat, wherein my health ID recovers all my data. Even if I am unconscious, they are able to treat me. Fine, well and good, excellent. For this to happen, 100% coverage of health ID of all the citizens is a must. For this, our connectivity infrastructure needs to improve. For example, take the last 2 weeks or 3 weeks in South India, we are going through monsoon. There's a lot of rain. There's a lot of electricity disruption. So is disruption of internet connectivity. So sometimes the public get dejected when they do not see what is happening. They want the benefits of any system. Right now, we are in the right track. We are creating all these platforms, but connectivity is a major issue. Similarly, in telemedicine, we can handle all primary issues of health using teleconsultations. But when it comes to examining a patient and prescribing him, there will be a lot of consumer-related issues as a physician I'm telling. There can be a question in a court of law whether this prescription was appropriate over teleconsultation without actual physical examination of the patient. All these issues need to be sorted out, but definitely healthcare will become easier with implementation of this in a vast country like this, because we have so much crowd waiting in our OPDs. Half of them can be cut down by telemedicine. And if we are going to implement NDHM in a big way, definitely we are there to benefit. But infrastructure is an issue.
Very good example, Dr. J. Ramesh. And there is one startup company is coming up, and they are making the booth like our ATM machine. And that booth is basically, the plan is that booth are going to placed in villages. And that booth has a lot of IoMT devices, which can measure your basically parameters. And the moment you will connect with the doctor through teleconsulting, doctor can see all the parameters and help the patient. So these kind of new things are coming where basically we can take our connected healthcare to our villages with the minimum interaction and minimum basically minimal questions we can ask. So these kind of things, a lot of development is happening. IoMT devices are playing a big role, and I'm pretty sure that when the 5G and AI will come in the picture, it will take our connected healthcare to the next level. So my next question is, Dr. Chandramouli, mainly for you, is self-testing at home also came up, right? We have the COVID testing, basically RT-PCR testing kit, which we can do at home and plug in with our phone, and basically we can get the result. Similarly, a lot of test kits are coming in the market in future, where you don't have to go to the lab for do the testing, and you can do the testing, those things at home, and then you can directly connect with the doctor through. So connecting with the doctor is proven sealed. Now, basically for the next step is, okay, a lot of testing is required. Again, you have to go to hospital, and there we are also working and progressing slowly. So what do you think, what is the growth in this space, especially in India and globally?
Yeah, sure. Yeah, let me take some basics before we answer that question. I think if all of us know, healthcare to be successful, technology can really help in improving quality. Technology can really help in improving access, because we have a poor doctor to patient ratio, which is probably getting corrected in the next 2 to 3 years. Enhancing access is definitely a key requirement for us to really provide quality care, because it's very skewed right now. And on top of all these things, at an affordable cost. I think these are the 3 parameters which are continuously come for a discussion wherever you go. The underlying parameters, which has already been covered by Dr. Ramesh and others, is largely, the infrastructure. The infrastructure not only is also on the technology, but also on platforms and processes, and or on the kind of the EMRs that are required today to really make some meaningful case of all this connected care to be a reality. I think we are also seeing a surge of requirement in terms of portals coming out with the EMR for people to really register and make the best use of their technology, share those information. Ayushman Bharat, particularly the National Digital Health Mission's priority is its consent-driven architecture, where you can really share information. I think so. The basic building blocks of any connected health requires certain basic ideas, which is securing information, having a robust IT system in place, and more importantly, putting the patient as the center of the entire engagement through consents and the ownership of the data. I think those are things which are probably coming around. But as we all really know, the biggest challenge in any kind of health today is also the compliance part of it. Because invariably, people lack attention to detail. They probably don't go by the doctor's advice or not to the level of detail that is required. That is where the connected care really kicks in. And we have seen this great benefit in the COVID scenarios. Actually, we have a lot of devices which can really help patients take your SpO2, stream it to the patient, from the patient to the doctor, or rather reversing the entire scenario, which Dr. Ramesh really explained very well, where how we can really bring down tremendously short of efficiency and make a better use of resources. Because doctors are under stress whenever there is a pandemic which really strikes. But leaving alone the pandemic, I think there are other use cases, say like the elderly care, for example. It's a good example where connected devices can make a tremendous amount of change, particularly for people who cannot really move from their beds or they can't really travel to the nearest doctor or things like that. I think where they can really make the best use of this kind of connected devices. It could be also on areas, say like chronic cases, say something like pediatry, for example, as a good example where this can really change the lives of the patient, or probably things like diabetes, for example, which requires continuous intervention, and where you can day-to-day monitoring of your basic vitals can really change with better with proactive care from the doctor, from the nearest doctor. That could really change many of these things. We have seen a lot of innovation in medical devices coming to play, with a combination of 5G probably coming around, which could be making a huger impact. But even the current technology itself is more than adequate to establish a lot of transformation that you can potentially think. From Shankara Nethralaya perspective, definitely we see a lot of changes. For example, in our telemedicine, all our basic vitals are done by the patient himself, even if it is at home through a telemedicine, or when they come to the hospital, we have devices where they can really measure and monitor and proactively enter all this data into the EMR. I think we are already seeing those benefits reaching to the patient and also to the doctors. And one of the biggest challenges today we have in hospital is patient waiting time. Not that we can't solve it, but I think the biggest challenge is every patient is so unique that we can't really predict whether somebody can take 1 hour or 3 hours or just 30 minutes, because it all depends upon the previous patient's health conditions and the doctor's availability and other emergencies and things like that. Almost every patient is a kind of a Six Sigma activity that we do to see that how more predictable that we are. And all these gadgets and devices and other digital enablers can really help us in improving the patient outcomes and also probably the patient experience. I think these are things that we really see as a significant change in the last 12 to 18 months.
This is great insight, really great insight. So now we are basically in the last segment of our panel discussion. Any last minute advice or any thoughts in 2 or 3 lines you want to basically say to our doctor community, our technologists, our people, how this connected healthcare are helping India from the healthcare perspective? And like a lot of things basically we discussed, that in low cost we are serving more, right? The availability of data, right? And where basically our old patients cannot move, and how digital monitoring and digital nurse can help them, so they don't have to visit to doctor or lab. Basically lab and doctors can come to their home, either physical or digital, right? So these kind of benefits we all are seeing. So any last minute thought, advice, prediction from your side, that how it is going to help India to fill the ratio between the population and the doctors' availability? So I will start from J. Ramesh.
Connected healthcare is here to stay in India. Ayushman Bharat Digital Mission, the Government of India flagship program, once successfully implemented, will be a real game changer. The important points to note here though are, so much technology is coming, so many apps are coming, so many companies come with the resolutions and solutions for issues, especially with the bedridden patient with multiple morbidity, which we see often in India with increasing elderly population. A direct patient contact care will become very essential. Day-to-day monitoring though, using technology is okay, but a doctor visit is often essential. Connected healthcare system is here to stay.
Dr. Chandramouli?
Yeah. See, one of the bigger ideas that we have been pursuing is to empower patients with data. I would rather say, how can I make individuals responsible for their own data, or make them the CEO of their own health, actually. I think that's what I would definitely say. And we'll try to pass on as much information back to the patients, because there is no better person than the individual who needs to have a better say on his own health. And unless he is better informed and better complying with the requirements and keep his health in good shape, I think this is not going to make a better difference, actually. And that's where the connected care can really make a hell out of a difference in terms of enabling patients to be compliant to the needs of the advice and things like that. It helps many other things, like even Dr. Ramesh said, is public good versus private health. I think the priorities are increasingly shifting. That's where the connected care is going to make a tremendous difference. And as we really make things a lot more easier, evidence-based medicine and things like that are largely putting data at the center of the entire conversation. I think all these things make patients a lot more knowledgeable and better informed. I think that's increasingly going to happen. I'm sure that this will be the order of the day in the next few years.
Thank you. Sunil?
As a technologist, I would recommend 2-3 things. One is basically we should design scalable applications. We should design integration considering from day one. That is as a technologist. And apart from this, one of the very important recommendation is basically crores of health IDs have been created, but its linkage with the health record is yet to take off. So my request to all the participants and fellow panelists is basically we should integrate our existing application and upcoming application, which are well integrated with all the building block of ABDM. Until unless we do it, we will not be able to achieve that objective. And apart from this, we have to increase the use of AI, blockchain, and IoMT and data analytics for the benefit of the last mile and for the benefit of patients. We have to ensure. That is what I would like to say.
Well said. And all inputs and all discussions was very, very futuristic, I will say. We are sharing based on our past experience, and it is very futuristic. And as Dr. J. Ramesh mentioned, and all of you said, that healthcare are not going to only stay, but it's grow more and more. And the reason which I feel is actually we are living in a physical world, physical and digital, where too much digital, the physical is stepping in, and where too much physical, the digital is stepping in. And that's why basically it's physical world. And I feel that the healthcare is mainly physical, I think before pandemic, where you have to go to hospital, right? You have to go to school. But now basically digital is stepping in, and taking their own share, and it is going to be a physical for sure, and it will help to our patients, to our doctor, to our technician, and of course, humanity. So thanks everyone. Very nice discussion. Thanks for your time.
Thank you. Thank you so much.
Thank you, Dr. Sandeep and our panelists for sharing their valuable insights. Before we go on to our next panel, let's have a brief video from our sponsor, EkaCare. And by the way, I'm hoping you all are sharing your learnings on social media using hashtag FE Digital Health Conclave, hashtag Financial Express, and also tagging us at Digital Health Conclave. We're having EkaCare next presenting a technology address.
Hello, everyone. And thank you so much, Financial Express Digital Conclave team, to invite us here on these prestigious podium. Today, I'm going to be talking about EkaCare and how exactly we see healthcare and what is our journey. But before that, I would like to take you through my journey as well a bit on how we stumbled into healthcare and a digital health ecosystem. So I was the co-founder, CTO of GoIbibo. I'm a developer at heart. Basically, I love writing code. Every day, if I don't ship a code into production, it feels that something is missing in the day. So basically a tech guy. Post building GoIbibo and merging it with MakeMyTrip, I got an opportunity to build Arogya Setu with Government of India. Me and a couple of folks in my team, they worked tirelessly with the government's team, NIC and everyone to bring about the largest contact tracing app in the world. Now, the idea there was to collect information, which is a health-related information, and provide that in a way that people can access it for their and their family's need. And that changed a lot in the way we also started thinking about providing solutions and building solutions as an entrepreneur. So during September 2019 and all, I was thinking of starting a new company, and that was on travel itself. But as I said, Arogya Setu changed the whole thing. With GoIbibo MakeMyTrip, we used to make people's dream come true by making them travel from one place to the other. But then healthcare gave us this opportunity to create even a larger impact, where we can build solutions that can let people have a better life with their loved ones. And that's how the whole journey of EkaCare started. We started getting the team in the month of January 2021 and launched our first product in the May with some very key thoughts that we always used to ponder about. And I'll just give you a sneak view on what are the kind of discussions that we used to do when we started EkaCare. Today, in this whole digital ecosystem, if you see, it's easier to find a date in 5-kilometer radius using products such as Tinder, but it's really hard to find an AB positive blood donor if I want to have them in the 5-kilometer radius, right? If you look at the other side of things, which is entertainment, in a remote village in the country, a villager or any family can actually go ahead and look at a YouTube video to get entertained while they are having a high fever, but it's not easy for them to talk to a doctor for an online consultation. And health, such an important thing today, is not available at the press of the button. Another thing which is very close to my heart is a visualization of my father's diabetic charts. Now, whenever we go to a doctor, the doctor looks at those charts on a diary, and these are numbers that are being displayed, and then there's all kind of calculations that is happening. Why can't we show those on a nice graphical format, like the way we as a business leader today see all our revenue numbers, etc.? I believe that those numbers are far more important to live a better and healthy lives. So these are the kind of discussions that we used to have that gave birth to this profound idea of how we can digitize the content that is available on health and how we can build a medically aware software. So we came together, we started thinking of what is our why, what is our what, and how we want to execute it. So our why was to build digital tools so that we can have a better health outcomes at a primary care, so that we can make sure when the doctor sees you for the very first time, that diagnosis is far more richer. What is it that we need to build to get to the better health outcomes at the primary healthcare level? Is to create a trusted healthcare digital experience for both providers and care seekers. And when I talk about providers, primarily it's doctors, physicians, clinicians, but over a period of time, it will be labs, hospitals, and so on and so forth. And how we started executing it to create by creating a first medically aware technology platform. And this is a very key thing that we started our entire journey with. We wanted to build a platform that can understand the medical concepts and not necessarily just a database where you can store the digital information and then create references to that. And over a period of time, as I take you through this presentation, you would get to know about how are we executing this. To build this, we figured out that we have to build a connected ecosystem. That means that our stack or a solution should have two sides of stories, one for patients, the other for doctors and physicians. Now, this is practically the way we have structured our software and application. Patients today have a health record repository. There's an application that can be downloaded from Play Store, App Store. There's a web ecosystem as well. There are certain key medically aware tech that has been delivered on our patient side experience, which is AI-driven self-assessment, where you and I as an individual can go and self-assess ourselves for any kind of ailments that we are having right now, or if we want to assess simply ourselves for diabetes and so on and so forth. More importantly, this has been built in such a way that this information that is getting collected, if you share this information with your doctors and physicians, they would be able to get to know much better about yourself while giving you treatment. There's another very interesting experience of storing medical records, and they actually, and we not only store these files, but we create a longitudinal view of these files by standardizing that content. There is an absolute consent management and sharing of documents. On the doctor side, we actually deliver this experience that a patient has created of self-assessment or storing a medical record into a medically aware end-to-end electronic medical record system, where doctors can not only understand more about their patients as they walk into the clinic or doing a teleconsultation, but they can also create and run their entire practice using the tools that we provide. Again, these tools are available in all kinds of ecosystem, be it an Android or iOS or desktop, tablets, etc. Now, what has happened is this has created this connected ecosystem where a patient would create the information, share it with the doctor, and the doctors would actually learn more about the patient and sends out the prescription or give any kind of advice. If you look at how this works, as you see, there is a patient tab, a patient fills the self-assessment. There are very simple questions that are AI-driven medically aware system asks, such as what difficulties you encounter. As you keep giving your inputs, these inputs gets converted into a medical language that gets transferred to the doctor who you want to share this information with. So your doctor will receive an information which is on the second screen, a pre-filled self-assessment where you are talking about what kind of issues you are having, what symptoms you are facing, and so on and so forth. Also, when you upload a report, let's go back to the question that I posed to ourselves, that how can I see my father's diabetic records in a longitudinal fashion? When you upload a record on Eka Care, a doctor would basically see those records in a longitudinal manner. And as a patient, you can also look at it. So this is the entire journey that a doctor basically goes through to provide a right kind of a medically aware experience. The journey happens like this. Let's say Akriti, she feels sick. She fills a self-assessment. As the self-assessment ends, there is a lot of information that gets collected. This information goes to the doctor when Akriti wants to share that self-assessment with the doctor. The doctors look at that self-assessment, talk to the patient. Akriti will tell more about any other things that the doctor wishes to know. Doctor fills prescription, suggested lab test. Akriti goes to the lab. Lab is deeply integrated with the system. That lab sends the information back to the Akriti's app so that she can see all kinds of vitals, how they are behaving. And not only that, once the prescription is generated, the app will help in doing all kind of medical reminders, and a health calendar for Akriti will get created so that we can get to that final vision of providing a better outcome. As I said, this entire thing works on an extremely proprietary tech stack. This is India's only medically coded health tech, where we ingest the data from multiple sources. And this data that is getting ingested is an unstructured data. There is no structure to it. There's a data processing capabilities that we have created, and we leverage all kinds of standards, be it LOINC for lab, ICD-10, SNOMED, where we have all kinds of ontologies. This gets stored into FHIR, which is the schema engine for us. We leverage many things such as OCR capabilities, natural language processing, our understanding of the ontologies to finally create a medical record management system, symptom to disease Bayesian network, and a vital monitoring for patients. Again, for doctors, an enhanced prescription pad and a teleconsultation abilities that is one of its kind. I'll take you through this journey on where we are right now. We've launched the app in June 2021. We have seen a lot of love from people around. We got access to, and thanks to Government of India for giving us access to CoWIN private APIs and creation of Health ID using ABDM's Rails. We today create Health IDs close to 10,000 a day. We have got 750K plus app installs. We have rated 4.7 on the app stores. More than 11 languages we are present in. And there is something that we have also to take pride on. We've built the app for entire Bharat and not necessarily just for the few of us who are in the metro cities. That's why we keep a lot of focus in creating an application that is available in all languages, all Indian languages. We have got 2,000 plus doctors onboarded. We have a beautiful use case where users come to us for their CoWIN certificate downloads and creating their CoWIN repository offline so that they can share it with people whenever in need. Using that, we have actually reached out to more than 576 districts in the country, and 20% of our app usage is actually happening in a language other than English. If you look at some of the way we are growing, our app is now having a steady growth on app installs. Our web traffic is increasing dramatically. A lot of people are coming there to start the journey from downloading a CoWIN certificate and then going back to the app to upload their medical records and so on and so forth. This is from traffic. If you look at some of our product numbers, we have created multiple health IDs at a run rate of 10K each. And make it their own personal agenda. Because if we look at in all our families, there are someone where we want to provide a help on the medical related aspects. With this, thank you so much for listening to our story, and we hope to build the trusted platform for connected healthcare for Bharat. Thank you so much.
Thank you, Vikal, for sharing EkaCare's journey with us. Now moving on to the next panel discussion, which is all about hybrid care for a healthy future. At least 94% of Indian healthcare leaders would most like their hospital or healthcare facility to invest in AI or artificial intelligence technologies in the near future. The healthcare organizations in India are set for a quantum leap in their care delivery roadmaps by embracing hybrid care models that bring together the best of telehealth and in-person treatments. Welcoming our panelists now, Dr. Avadhut Parab, Global CIO, Walk Hard Limited, Dr. Nandkumar Jairam, Independent Healthcare Advisor and Consultant, MEMG, Dr. Ashutosh Raghuvanshi, MD and CEO, Fortis Healthcare Limited, Kunal Kishore Dhawan, co-founder, Novia Lifecare, and our moderator, Dr. Rana Mehta, partner and leader healthcare, PwC Services, LLP.
Welcome to this session. I think we have a great panel and I can't wait to get started. I think the last 1.5 years have truly been very, very different because, we always thought about a double burden of disease, acute disease, chronic disease. But pandemics to a large extent were, something which was limited to the textbook. But having the pandemic actually play out has taught a lot of lessons. One is that we never realized that ultimately the world could come down on its knees with such a humble assailant of a virus which is borders between, which is just like a spiky ball of lipids and bordering between the living and the non-living. The second thing I think we realized that, a healthcare crisis could cause an economic meltdown. Wherever previously there have been economic meltdowns, it's been either due to war or due to a financial crisis. While we have a great playbook for an economic crisis, we had no playbook for the healthcare crisis. The second thing we've learned is that there's exponential growth of the virus, and you have, a very slow decline. I'll begin with Dr. Raghuvanshi. So Dr. Raghuvanshi, I think the first time we found due to the lockdown, mobility stopped and people couldn't move. So they couldn't go even to the healthcare provider. And especially in case of COVID, unless you really had COVID, it all came to a standstill. So I think the concept of hybrid care was both catalyzed and forced on us. It also made hospitals which typically look at only acute episodic care, look at the continuum of care. So how did you see this evolve in the last 18 months?
Thank you, Dr. Mehta. I think, the last 1.5 to 2 years have been so clouded with the pandemic, and almost everything in the narrative has been shaped by what the virus has brought upon on the industry, on people's health, economy, and as you very well illustrated on the entire world. But I think there are certain silver linings in this cloud, and one of them is the rise of digital in the delivery of healthcare. And for many years, and I have been sort of at it for almost more than 2 decades, and a lot of organizations and people have been talking about telemedicine and virtual consults and things like that. But all that technology, even though it was very freely available for other areas and other industries, was never really translated and got adopted so much in healthcare. There was a resistance from both the providers as well as the consumers, the patients themselves. There was a hesitance in using the digital platforms and technologies, which were quite freely available. So I think in a way, the pandemic forced our hands to accelerate that whole process. And I think that has been a very good thing which has emerged out of it. As you know, that there are the physical hospitals which are only focused on acute care. They have never been so concerned about the chronic care. And that becomes a very, very important gap in our healthcare delivery system. And that makes the healthcare system also very, very disjointed. So digital plays a very pivotal role in bringing all these things together. So when the pandemic started and the lockdown happened and people couldn't travel and access services, so we had no choice but to activate all our virtual consults. And that became a very major part of how patients engage with the hospitals. But what we have noticed surprisingly is that as the wave has receded, more and more people are coming back for physical consultations. Having said that, there are certain areas like primary care, mental health, and all these areas seem to have completely moved to the virtual platforms. And I think they will keep on growing. So it is something which was required. And I think it is going to play a very important role, especially in chronic disease management. And it will certainly improve the outcomes, and it will make life so much better for the patients, because they get the entire ecosystem of care and a continuum of care. Which will certainly not only improve the outcomes, but it will be more economical as well. So I think this is the direction to go. And in a way, we should thank the pandemic that it has catalyzed and triggered this whole transformation.
No, excellent. So Dr. Raghuvanshi, I think the silver lining of the pandemic, besides the blue skies we saw last year in Gurgaon, was obviously that it's catalyzed the whole digital space in healthcare, where we were reluctant. Very similar to, I think, on the vaccine, where you got the vaccine typically in 10 months rather than the 10 years if the pandemic had not taken place. I'll go next to you, Dr. Jairam, and I think as we look ahead, and Dr. Raghuvanshi mentioned, the next decade is going to be very different, and especially areas like who's responsible for your health. And a lot of it is coming, I'm responsible for my health, especially the do-it-yourself care. And like Dr. Raghuvanshi mentioned, primary care also moving away really from a setting, which is a high-cost setting of a hospital, to right into your home. There were instances of even an ICU being set up at home. So Dr. Jairam, how do you see the next decade panning out, especially in an Indian context?
Morning, Rana, and hello to everybody. It's a pleasure to be here. Coming to your question, yes, I think, every decade in healthcare promises to be exciting in one way or the other, but the next 10 years is truly going to be revolutionary, and there's no question about it. Look at what we need as healthcare today. By and large, if you look at the health needs of this country, it is directed towards the management of non-communicable diseases and their complications. Currently, hospitals and healthcare is tuned, as Dr. Raghuvanshi already said, towards curative aspects. That needs to change. It needs to change not just by saying that preventive and wellness is the way forward, but also that the responsibility of this wellness and preventive care is going to rest with the patient or the person himself. And there are clear reasons for this. One, the cost of healthcare, especially if you access physicians. Two, the non-availability of adequate numbers of qualified physicians. And three, the availability of technology. Today with apps, you can look at your own blood count, your own blood sugar, your own blood pressure, and enable it to change by the knowledge that you possess and by the drugs that you're taking. So this is the first change that I see as far as the next 10 years is concerned, greater and greater self-help to prevent and improve your non-communicable diseases. The second is I see a further movement in the area of telemedicine and teleconsultations, and not just stopping at that. There are going to be methods by which remote care and procedures can be delivered. For example, it is possible today for a gynecologist sitting at a distance to virtually help a nurse deliver a difficult pregnancy. And this is going to advance further, and more sophisticated tools to enable procedures and procedure-related aspects to be conducted under supervision is definitely going to change. And there is enough technology towards that. The third is going to be the use of artificial intelligence. Definitely the data that is currently coming up and which will come up in the near future can be collated, sliced and diced, and artificial intelligence created, which will help, I'm not replacing, but which will help medical care to reach a better level of sophistication. Finally, I think all this will be aided by a comprehensive technology which will involve itself in every nook and corner of healthcare, whether it is the EHR, whether it is an electronic stethoscope, or what have you. I think the way of the future is technology which can help in everything that I have stated. Exciting next decades, and I hope to be there to watch it.
No, thank you, Dr. Jairam. And like you said, it's probably going to get ubiquitous. Technology gets embedded. There's been a lot of reluctance in healthcare, and unlike other industries, we are probably laggards. But I think this has probably been the pandemic's catalyzed this in many ways. I'll go next to Dr. Parb, and one of the things we looked at, and you've heard from the leaders in the healthcare delivery space, how it's changed. I like to know, especially on the pharmaceutical side, because pharma did play a big role, right? From the fact that the vaccines came out in record time, to the fact that we've never had many antivirals, and you have 2 antivirals which are on the cusp of being approved for COVID. But we'd be more interested to say, how did the whole digital component play out on the pharmaceutical side?
Morning, everyone, and it was really a pleasure listening Dr. Raghuvanshi, of course, and Dr. Nandakumar. Very interestingly, let me just touch 2-3 points before I get into the pharma part. Digital has been in space for, I would say, at least a decade now in different pace and all. Like we also have something, Wokhard Health, Wokhard Foundation, which we try and reach poor and needy people in the villages and all kind of things. So for them to come to even do their blood test, they have to not only come to a proper urban areas, compromise their daily wage of that day, also spend the money on that. But today the digital technology is doing all those blood tests at the cost of 5 to 10 rupees. We have reached to that technology and we have implemented. It is not something which we are conceptualizing. Within a 5-10 rupees, we can do a blood test, the sugar, the other key component, and we can know, okay, this is the primary. So primary healthcare has become mobile, has become reachable to poor and needy people, not necessary for so. And everyone has started believing and accepting the digital change and digital technology, digital device, because every device has started becoming an intelligent and can connect to it. What has evolved out of this is the ecosystem integration has become easy, which was otherwise wouldn't have possible, whether the partners, device people, pharmaceutical company, healthcare device. So all that has become, the handshaking has happened very soon. Now coming back to the pharma and vaccine. So this area, I would say the drug discovery part, if you look at it, it was always been in the span of somewhere 5 years, 6 years, 7 years, or maybe 4 years, nothing below 4 years. Now, why? Because there are, if you just dissect that, there could be around minimum of between 70 to 80 gates from drug discovery to go to market. So that's the kind of complexity which is involved. Yeah. Now, at every point, the human due diligence has been supported by artificial intelligence, and the technology has matured now. Accuracy level has gone up to a level of 90-95%. In some cases, it has even surpassed that as well. Now, 3 areas where your launch, go-to-market or the product from discovery to reaching at the patient takes time. 1, definitely finding the molecule. 2, the clinical simulation and testing. And the last one of the clinical trial is preparing the proper clinical trial report from phase 1 to phase 2 to phase 3 and presenting it to regulatory for their acceptance. Now, preparation, I'm just going from last to first. Preparation of the report today has been extremely technology driven, and we talk about NLG and NLP, natural language generation, natural language processing. The effort of between 8 to 12 months has now crushed to between 1 to 2 months, or even lesser than that, or maybe 3 months. So that's the kind of time crush which has happened from a year to few months. Maybe recently you see it happens in 1 month. So that's the one area, and you don't need a human repetitive reviews, because technology has done such a good job. You may very little need a technology. The discovery part. Now, discovery part, you are always dependent upon the talent, where today you have AI models, and you give some of the parameter and it will find, okay, these are the areas it will funnel you out very quickly, which again is several years. Simulation otherwise was taking huge time. Today the devices are so intelligent, it will accurately simulate to what you need. So scale up is different. So the point which I'm bringing here is it is a complementing technology with the processes which otherwise would completely human and the skilled human dependent. Today, if you can execute the clinical trial across the globe and you still know what is happening because your ecosystem is integrated. Technology, actionable MIS has been one of the big area. If there is the reviews have become only a review by exception, not 100% review, because technology has taken over. So these areas has really shortened and we have seen the live example about vaccine which is coming up, which is near to the very effective. Efficacy is very high, and we have proven to the world. Cloud technology has played a very prominent role. One of the use case of Pfizer's, which is Moderna and all, they have done a lot with the AWS. So this is a story. Now the last part just before is, while this was happening, the parallel, even a manufacturing today has been a very intelligent device, intelligent equipment. So the predictive part, the process predictive has reached. So the failure rate or the turnaround time has been also been reduced. All that has resulted in a faster delivery of the product, go to market, and all of us could get the vaccine very fast. And this is becoming a new normal now, how technology can be used not only for efficacy, efficiency, productivity, and the sustenance part of it. So it's becoming more and more, every organization has started looking to it. This is in short, Doctor.
No, thank you. And I think, in a way, we always thought of ourselves as, healthcare companies, pharmaceutical companies. But I think in the backbone going ahead, we'll always want to think of us as technology companies. And, how can we, and, we always have a traditional operating business model. But I think going ahead, your operating business model depends on the technology you use. As the technology changes, your operating business model will also change. I'll next go to Kunal. And Kunal, I think amongst everyone, has had the experience of doing this himself, building an online and an offline presence. Through that process, there have been a lot of learnings about, what does the customer want? What will the customer pay for? And how can you scale? So Kunal, why don't you tell us about some of those experiences and learnings you've had, especially in the last 18 months?
Yeah, thanks so much, Dr. Anna, and thank you to everybody else. I think great experience listening to all of your experiences. So for us at Navya, basically, the mission from the beginning was to build a platform that allowed for both online as well as offline transactions. So healthcare transactions or interactions, as you might think about it. If we rewind ourselves maybe 24 to 36 months, When we used to go to meet with doctors, specifically because of our target audience, when we went and met with those doctors, it was always met with a little bit of hesitancy, with a lot of inertia with respect to adopting digital or any kind of a technology in their clinical plays or kind of their workflows, daily workflows. But what the last few months or maybe about 18 odd months has done is that it has brought out a necessity, as all the panelists also mentioned earlier, in their day-to-day operations on how best to conduct consultations, how best to speak with their patients, how best to have these healthcare interactions on a daily basis. So there has been a significant shift in terms of the inertia or rather the awareness that or the necessity as well that these doctors have shown. So and this has actually translated into the way digital is being propagated as well. So from a point of view of a healthcare technology provider, when we, instead of going and meeting doctors per se, now we are going extremely, digitally. We are doing our marketing also digitally. Everything is being done digitally. We are interacting with the doctors through virtual means. It's a significantly less focus on feet on street. So, less of requirement of manual capital or manual labor in terms of being able to reach out to a large audience. So there has been a significant shift in the way propagation of technology has also started to happen. Additionally, one very, very important thing that has come out is the use of certain kinds of platforms versus the others. And that has all stemmed from the fact that how easy is your product to use. So all the traditional HIS companies, all the traditional HIS providers have always had these kind of solutions in which they could digitize prescriptions. They could allow for storage of lab reports and so on and so forth. But doctors were never very enthusiastic in utilizing them. That is because doctors are ultimately hard pressed for time. Asking them to type out large clinical reports or long prescriptions would have been a significant waste of their time. So building a product or building a platform that allowed doctors to use technology in a very, very simple way was kind of critical to being able to initiate or being able to get doctors to utilize it very, very effectively. And that's what we also did here at Navya as well. So building an easy to use product, building something that takes into account a lot of AI, machine learning. It takes into account clinical protocols, pre-filled clinical protocols, etc., became sort of critical in being able to provide the right kind of a platform for doctors to use. So these are some of the key learnings or key methodologies that we adopted at Navya to essentially help doctors move into a digital ecosystem.
No, thanks. Great. So I think two takeaways from that. One, I think ease of use is very important because, and secondly, showing the value proposition to the doctor that, by doing this, not only can he serve his current patients better, but have a bigger cohort of patients which may not physically come to him. Dr. Raghuvanshi, I'll go back to the fact that, while we got into both this physical as well as that digital, but with India, every time the problem comes is how do you scale it to the next level? In fact, even at the pandemic, we saw during the pandemic, the rules and guidelines on telemedicine were notified. Prior to that, it was a gray area. The problem with it being a gray area, it fails to attract investment. Even today with data privacy, there are a lot of components of the whole digital revolution in healthcare, which are not clear, especially because you're dealing with patient data. So what are some of those regulatory changes you think we should make as a nation if we really want to give a technological access to, say, 1.4 billion citizens?
Yeah, I think you have hit a very important point, and that is regulation is going to be an important thing as these platforms expand and the service offerings are expanded as well. Some of my thoughts are that, that we are thinking that in the data privacy, there are a lot of constraints which are going to come in. But I think those are very important. And I think we are lucky that way that we didn't have an existing framework, and we are getting a framework at this stage so that it is incorporating a lot of learnings which have come from other regulatory frameworks. But still, I think the regulation has to move as fast as the technology moves. Unfortunately, there is usually a lag, and the regulators are trying to always catch up with what has already happened. And I think that is one thing which is very important. And because of that, I think the policymakers and the regulators will have to become a little more nimble and fast. Unless that happens, they will be always trying to catch up.
Exactly what you said. That could be the next roadblock. While I think we are ready on the technology side, we're changing the culture within healthcare. But to catalyze it, correct regulations are required in that sense. On a similar note, I'll go to you, Dr. Jairam. I think we're talking about a lot of technologies, and artificial intelligence particularly seems to be there because globally, it's seen that we have what's called an AI fallacy. Doctors think everything they requires empathy, it requires judgment, it requires patience. But most of what they do actually requires only data to be processed. And truthfully, it's been shown that an AI algorithm may be much better at humans in processing data and coming up with better outcomes. But then that again throws its own set of challenges of, both on the physical and digital side, defining the role of technology and defining the role of human. How do you see this panning out, and what is the governance around that?
I think AI will go step by step into the practice of medicine, starting from now on to the next full 10 years or more. The starting point really is to use it to aid current medical diagnosis. By that I mean that the artificial intelligence gives you a suggestion that this could be the diagnosis and this is what you need to do. But the ultimate decision still rests with the clinician, and the signing off of the final clinical diagnosis still remains with the clinician, and that is appropriate. As we move along, this can change. Let's take the example of an evolving AI radiology platform, where AI has developed sufficient knowledge to be able to diagnose lung conditions, or for that matter, read retinal images. The accuracy of AI intelligence is going to progressively improve. And what AI does is actually give you the intelligence of not one single person, but of a collective brain capability of human beings. So over a period of time, AI will refine itself to such an extent that certain tasks, and I repeat, certain tasks may move solely into AI. In this process, what is vital is the appropriateness of data that goes into AI and the volume of data that is used to build that AI. If you have an AI system that is fallacious, then all hell will break loose in terms of clinical diagnosis. And that is why I said this will move step by step. So what is likely to evolve, as I said, is progressive increasing amounts of data to more authoritative, acknowledged, and appropriate data. Let's accept this. In India today, for example, can we say with our hands on our heart that every single bit of data point that is available to us is honestly declared? The answer is no, I can't say that. So that needs to come in the building of AI. So the governance of AI will have to include all these factors. A, how appropriate is this AI built upon the data, the points, and the volume of data, the appropriateness of data? Two, what does it endeavor to do? Now, if AI is ultimately going to make a clinical diagnosis and treatment is going to be based on that, that is a huge thing. And to reach that, and to reach it effectively and appropriately, that AI will have to be licensed like a doctor is licensed with the practice of medicine. And until we reach there, it cannot happen. So governance will also follow, just as Ashutosh said, it will follow the growth of AI, but I don't see it evolving and closing in the next few years. It will take a decade before we are appropriately managing and governing AI and its use.
Thank you, Dr. Jairam. So I think it's clearly an evolutionary process. It would take a long period of time. The second thing, in healthcare generates probably the greatest data of any industry in the world. But I think we're very poor in converting this data into actionable insights. And that's where the algorithms will come in and catalyze the whole process. I'll go next to Dr. Parb. And one of the things I think you did tell us how, the pharmaceutical industry has really got revolutionized using technology. But how do you see this going ahead? Also, I want to understand, how do you see the boundaries blurring today? There are hospitals, there are insurance companies, there are medtech companies, there are pharma companies, there are life science companies. Can technology actually blur these boundaries? For the patient, it's ultimately about how do I keep well?
Yes, you're right. Technology has, in fact, it has already started. Many of the pharmaceutical company, including Wockhardt, which has forward integration with hospital and backward integration, I would say, with the drug substance, which is used in many of the medicine. And now, if you see the pharma industry is slowly moving towards the personalization of a drug, which is coming up in a big way, and the smallest variant of it is also in market today, and that is like this. If earlier people used to take a pill, which is twice a day, thrice a day at interval before after lunch. Now that also is been fading out, and they say you take a one pill, which internally the technology is built in such a it has a delayed release. After few hours it will release and all kind of. So this is one way of looking at it, how pharmaceutical industry is looking at in helping the patient. So that's the area where regulators, even US FDA or the MHRA or the other regulation, including India FDA, a lot of debate is happening on that front. Coming back to the ecosystem, if you see, the ecosystem has evolved during the COVID time, and at least the pharma companies, they are well connected with the doctors now when it comes to providing them technical details, not only technical detail, how can we help them to set up the digital clinic, how we can connect the hospital. The insurance are also getting. The major problem is the regulations today. It is not just the equivalence of data protection, but the healthcare data is a sensitive data. It goes beyond the personally identified information, PII data. So what our data protection law is at PII level, but it is not addressing the sensitive data as of now. It might definitely come back. So these regulations are really not allowing, because there is an unclarity on the regulations. Things are not going so fast on the implementation. However, while if in the country like India, if we start with regulations, then the innovations may get suppressed, and I think government is well aware of it. Because of that, I think they are just encouraging the innovation first, get the options, solutions, providers to pitch in and provide the alternative or a complementary solution to the physical activities. and then see how this can be fit into a regulation. So that's the move which we see it. Otherwise, your innovations will have a lot of start, stop, and flourishing the startups may be difficult. So there are pros and cons, but at this, I think government is mindful about this, both the growth of the startup and the infusion of the regulation to protect the personally identified information. Lastly, if we keep out our PI and sensitive data, which is just 5% of the data, but the actual assistant is happening on a 95% of the data, which is anonymized, and where today industry, today society is getting benefit because of various AI models, as doctor said it, on the ophthalmic side, on the lungs, and any detection image processing side. So this is what I feel my view is, and over to you.
Thank you. And I think you reinforced it that the regulatory environment needs to be balanced. It should not stifle innovation, but at the same time, it should be able to attract the best talent, knowing that what they create will be legally valid.
One of the point I just wanted to make, which I missed, is the cyber security also, because that's also a concern which we need to embark, because the startups and which are coming at this juncture of time, they are not fully secured when they are deployed. So all as an organization, or as a the first mover, the cyber security, data protection law, and the utility and the purpose for which the tools and technology is moving towards needs to be seen in a adoption. And the good part of AI model is it has a very clear progression. One is a training data for it, or validation data, and the accuracy side of it. So though it is taking some time, but the model of making it more accurate is already in a place. We see that is happening. So sorry to just add on something more.
No, thank you. And I think that was very insightful. For the last, I'll go to Kunal again. And Kunal, since you've been part of this startup, you've set it up, you've seen this whole thing changed. You've seen how 18 months has really catalyzed the technological access to care. How are you actually now reimagining healthcare in a post-pandemic world? And what are some of the lessons for all of us?
Yeah, thanks for the question. I think it's really interesting where we are today, and how we the last 18 months have pretty much changed the way we want to think about healthcare, how we want to kind of progress as an ecosystem per se. So the first things first, I think it's fairly clear, and that is the whole point of the panel as well, which is sort of a hybrid care model, which is like it online and offline is going to work hand in hand. India is a complex country with a lot of restrictions, geographical restrictions, economic restrictions that people have to deal with on a daily basis. So having a one-size-fits-all policy may not work effectively, even in the most advanced of stages of AI, ML, etc. So we are going to be somewhere in the case of where there will be an online-offline hybrid. Already certain areas, as Dr. Ashutosh had mentioned earlier, that certain specializations like mental health and primary care are moving increasingly towards online, whereas some have moved back to their offline methodologies. So somewhere there is going to be some sort of handshake between the online and offline worlds, and doctors are going to be increasingly supportive of this movement. Second, I believe that through this digitization of the ecosystem, we are moving into a more connected world. It is going to get accelerated, especially with respect to the ABDM coming in, Ayushman Bharat Digital Health Mission, which actively wants to promote digitization, connectivity, easy sharing of health information across a very, across a single framework. So like we had the FinTech framework, which is centered around UPI. We are going to have a healthcare framework centered around UHI. So here again, it's going to be an online-offline mix with the easy access of data of patients as well as providers, as well as certain pharmaceutical companies and so on and so forth, all across the ecosystem. So some kind of a phygital backbone. And third, and I think this is kind of more futuristic, and this is something that we should be mindful of as we go forward, is the implementation of Web3. Already we are seeing the implementation of Web3, the use of blockchain, the use of the futuristic technologies in the other ecosystems. We are seeing it happening in financial technology. We are seeing it happening in banking. We're even seeing it happening in one of the most traditional segments, which is real estate. Smart contracting and use of cryptocurrencies in crypto. Not in the form of a legal tender, but more of security. And decentralization. So with this whole decentralization, I do expect the healthcare ecosystem also to move a little bit on the Web3 side of things. To accelerate that, for example, when we are building our backend, we are building it to become future ready. We are keeping it, we are moving it slowly towards, towards Web3. We are moving it onto the blockchain so that sharing of information, sharing of health data becomes more easy, more accessible, and that's going to be driving the next wave of innovation in healthcare, being able to get that data easily, being able to treat patients using that data, make effective health decisions, actionable insights. It's going to be accelerated as Web3 comes along. So I think these are the key 3 points on which I believe the movement of the health ecosystem is going to take place in the future.
And I want to thank the audience for taking the time to listen to all of us. Thank you.
Thank you so much for this insightful session. Before we go on to our next panel, let's have a brief video now from our sponsor, Cloudera.
Have you ever wondered how we sequence the human genome, or how we'll send humans to Mars? Well, at Cloudera, we believe that data can make what is impossible today possible tomorrow. Cloudera.
Let us now proceed with our next panel, which is on role of pharma in creating patient-centric healthcare ecosystem. With the increased digitization of patient era, the role of pharma in driving value across the healthcare system becomes even more pertinent. Pharma companies can support the emergence and scaling of digital health solutions and empower the healthcare ecosystem stakeholders to create value for patients. Welcoming our panelists now, Vibhuti Gupta, Head, Strategy, Commercial Excellence and Learning, Cipla India Business, Sheetal Ranganathan, CSO, Roche Pharma India, Joy Chakravarti, COO, PD Hinduja Hospital and Medical Research Center, Feni Mitra, BS, Head Digital Transformation India and Emerging Partners, and our moderator, E. Kumar Sharma, Deputy Editor, FE Digital, the Indian Express Group.
Hello, everyone. Welcome to a very important session in the conclave on the role of pharmaceutical companies in the creation of a patient-centric healthcare ecosystem. We are absolutely delighted to have a very eminent panel to share their insights on a subject which is constantly evolving. Without much ado, may I begin with Ms. Vibhuti Gupta. Ms. Gupta, as someone who's deeply involved in evolving the strategy at Cipla, how concerned are you that leading brands are not reaching remote locations in the country, and there is need to deploy digital tools? I ask you this also in the context that perhaps you could throw some light in terms of what perhaps drew Cipla to acquire GoAptiv in June last year. So if you could tell us a bit about your whole thought process when it comes to these digital interventions and the role of pharma, and this whole approach that you have adopted here, and that could be a good way to begin.
Thanks, Mr. Kumar. So I would start with our investment with GoAptiv, and then I will speak about how we have been leveraging digital, not just in reaching out to the patients in different geographies, but also how we shape the entire experience of care for the patient. So we started with the GoAptiv investment last year to ensure that our reach of our big brands is accessible to the patients in town 2 to 6. And with that model, we partnered with this company, and our entire journey started a couple of years back. And we saw that this is helping us taking our big brands to some of the interiors of India, where there is not just the play of the doctors, but also some of the retailers as well as stockists play a huge important role. And that's how when we started our investment in the GoAptiv. So now talking about the digital. So historically, pharma industry has been highly product centered for a long time, and it has been trying to shift gears to become truly patient centric and drive patient engagement. But COVID-19 has really accelerated this in pharma, and this gave an opportunity to pharma to radically rethink and reimagine its business model. And actually, pharma really reimagined how to build the end customer relationship into their core business model. So it's no more just about the communication, the patient advocacy, or outsourcing an awareness campaign to digital agency. It is much more than that. It is about digital diagnostics, remote patient care, point of care devices. How do we manage patient remotely, and also give options to patients in terms of not just the pills, but plethora of services to manage their disease home on their own. And today, pharma, I feel, is embracing digital as well as data for personalized patient engagement. And this is where, patients themselves are increasingly expecting pharma companies to provide services that complement their products.
Personalized patient engagement, very crucial, I think, and all the other aspects that you referred to. So I'd be more interested in also learning at later stage, perhaps, about how serious is this issue of actually major brands not reaching up to the remote locations. Perhaps that we could come back to it later, perhaps. But now Ms. Sheetal, actually, as part of a global MNC, which is operating in India and perhaps would at some point of time want to see itself also as an Indian company and a major play in cancer care, really. It would be nice if we can understand from you, maybe in a global context, India is still a smaller market, but it's a growing space, and especially in oncology also. How is the digital medium going to guide your patient engagement? How do you see that happening? How much is the scope for product innovation, the way information is shared, and all? If you could perhaps throw some light on that.
Going digital isn't just pertinent. It is actually a matter of survival or staying relevant, no matter which geography one is in at this point in time. So look, pharma, or at least global pharma, is really not that new to the adoption of digital, of the what we call the fourth industrial revolution technologies, whether it is analytics or AI, ML, advanced computing, IoT, communications, etc. But in pre-COVID times, this was really restricted to the core of its being. It was niche. Only for sharpening the innovative edge, when digital was taken a part of R&D to do transformative science. And the two leading indicators of that is the mushrooming of digital health startups all over the world, in the last 4 or 5 years. And pharma industry is obviously the biggest buyer or collaborator or a co-creator of these things. But now with COVID, you see the definition of digital for pharma has suddenly expanded, and it has become more mainstream, which augurs a lot of change management. And as I said, a market is no longer relevant because COVID has actually brought everyone to the same page in two areas. One, the consumer, or we as people, have become more aware of our health and the power of our data, or the health data. And we want to participate in decision making and want to own our data. And that's where I think Vibhuti was also alluding to, that we are drifting towards personalized healthcare, whether it is in the preventative setting or the curative setting. So to stay relevant, and the second really important trend is that it has now become a connected care world. So suddenly a large part of healthcare, which is seen, or the visible part of healthcare, has moved from patients or service providers' view of healthcare, has moved to in the digital realm. So with telemedicine and e-pharmacies and health monitoring apps, etc. So to stay relevant, both global and Indian pharma companies have to continue to ensure that the servicing arm, which is where our touch points include stakeholders in the digital world who have also moved in the digital world. So we have to ensure that we continue to offer the same kind of personalized, effortless, and valued experience that they already have with us elsewhere in the physical world. So what does that mean for India? Is that for pharma to stay relevant, again, I'm not delineating between MNCs or Indian pharma companies, is we have to do three things. And we have to make digital central to our daily work, which is to adopt digital customer engagement in the way we interact and engage with our stakeholders, which are both healthcare professionals, to promote our products, also with patients to support their disease management and healing journey. And especially in oncology, this is so complex, as you know. It's not just emotionally straining for the family and the patient to manage one's journey through cancer, but it is also extremely administratively difficult because the treatments are extremely complex, and the way people react to their cancers and their drug regimen is absolutely individualized. So there is a need for all oncology players to be able to connect with the patients, to be able to offer them customized or personalized support to the extent possible. Second thing is that we have to, as pharma executives and as people who work in the pharma industry, we have to adopt a consultative and problem-solving mindset, because all of us have suddenly entered a new world. Its problems are unknown, and they warrant new solutions or tweaking of the traditional solutions using tech, which means new ideas and new solutions that do not exist as of now have to be co-created with customers to solve certain points in the patient journey. So again, it cannot be a pick and adopt approach where whatever is happening in the global market can just be taken as is in India. India requires solution for its own problems. They have to be tweaked or they have to be co-created, which have to be India specific. And the third thing, and I would stop after this point, is to react at the pace that this tech-enabled world is moving at. I think internally as companies, we have to modernize our own house to be able to serve our customers with a low reaction time, which means we have to integrate digital in our own internal capabilities and the tools that we use. Because to be successful, we have to get really good at how well we know our stakeholders and their journeys, and how we leverage the insights that we get from this knowledge through analytics to offer the most optimum solutions.
Yeah, I think that's quite a landscape covered, actually. I think a very detailed answer, but I might want to first come back on this element which you said about co-creating with the patient audience, and about especially I think in the context of perhaps clinical trials, if some clinical trials could be held here, looked in terms of innovation. Also, there is perhaps as a leading company, you would have also noticed about information to the patients in terms of how information is shared, and perhaps also about the spurious drugs, if there is some information that education and all of that. Perhaps we could come back to that. Let me jump now to Mr. Fani. Mr. Fani Mitra, if you could share thoughts about, tell us a bit about this digital transformation approach that you are adopting. And I see a new initiative which has also been put in place by your company, Swas Wellness, which is. So what do you intend to, if you can tell us a bit about that and this approach that you're taking, where you talk of OPD patients and look at that, some sense of the way you are approaching it and what you see as the way things emerging.
Yeah, thanks, Mr. Kumar. I think to me the digital transformation in the country is driven a lot with what's happening outside in the market. A lot of tech startups, government's own intervention with NDHM. Pharma players like Sheetal talked about, thinking more about connected care. So there are a lot of right triggers coming into action at this point in time. For us here in Dr. Reddy's, there is also an internal trigger of taking our purpose of good health can't wait a lot more seriously, and we wanted to explore what that means to us as a company. So I think these are the two two drivers for thinking about transformation for us. I think the other panelists briefly talked about it, but the innovation in the pharma space with with patients rightly at the center of it is happening across three streams. Digital, data, and more importantly, it is the human-centered design. I think a country like us, with its myriad problems across healthcare delivery system, has a lot of need for us to think patient-centric design first, and then apply the data and the design elements into it. So for us, transformation connected care essentially starts off from that kind of design thinking. And one such idea is briefly what you talked about, Mr. Kumar, that we are piloting right now, which is about SWAS. And SWAS essentially tries to take one of the problems that we face in this country about outpatient care, while there are millions of patients getting into the outpatient ecosystem, and if essentially that is harnessed well, the stress on the inpatient infrastructure actually can come down significantly. I think that's the interesting spot that we wanted to explore and bring in the elements of design, data, and digital to it. So SWAS is our pilot, trying to work with some of the largest insurers in the country to bring, or at least pilot, some of these outpatient service initiatives, orchestrating this with the digital platform so that patients essentially get the care they deserve, and there are inbuilt efficiencies that obviously a technology platform can bring in. So that's the broad idea of SWAS, but digital for us essentially means beyond that. I think we briefly touched upon patient centricity. I think as a pharma, as an industry, we have been focused on one part of the patient journey, which is primarily about the illness. But I think the industry and the ecosystem is essentially moving from an illness to wellness kind of paradigm. And when you think of that, there is a bunch of solutions and spaces that actually pharma can actually play a very, very, very important role in. That's taking the patient's journey all the way to wellness, and that is where I think Sheetal briefly mentioned our focus has been about educating the customers or HCPs about how our products work. But we are now moving from customers to patients to consumers, and that is a wide ecosystem, wide value chain that all of us can play in. And I believe personally the time is ripe. There are a lot of interesting players. There's a lot of infrastructure challenges that are getting addressed. If NDHM takes shape in the way it is being thought of, I think there are interesting times ahead for all of us.
Thanks so much, actually. And when you mention essentially this thing about SWAS, actually this is OPD cashless, isn't it? For everyone to be able to.
That is right.
Essentially.
That is
so
right.
For that you intervene, you tie up with the insurance companies.
Yes.
And provide that.
Yes, we would ideally want to orchestrate the entire outpatient journey with insurance obviously playing a big role, but we orchestrate the journey digitally, connecting the pharmacies, diagnostics, as well as doctors via one single platform. That's the broad idea that we are experimenting with.
Mr. Joy Chakrabarty, you've heard the people from the pharma space, the companies mentioned their view in terms of how they are themselves actually looking at this whole thing, and how they are actually coming in with their own approach to this, which again is quite fine-tuned, and the way each of them is actually articulated. You as a healthcare provider, as a hospital, what do you see as the role that you yourself see for your own institution and for the pharma, and how as a healthcare provider you're gearing up to meet the needs of this changing world, as it were?
So thank you very much. It was very nice to hear from my two earlier speakers that how their company and they are adopting the digital health. And I want to share that in PD Hinduja Hospital, probably last for 5 years, we have gone into this patient experience program. And in this patient experience program, we have integrated and we have adopted the complete digital process and the digital way how we can match our patient expectations. Just to give you little, to make it more pertinent, I want to share with you that in 2016, probably when that all these 500,000 notes, all demonetization happened, people were struggling. And how do you manage? Probably you are one of the healthcare provider who we never thought that it is going to happen, but we geared up with all sorts of digital payment method, and we never had any issue in terms of the transaction in the hospital at that point of time, because we geared up into that platform much in advance. Apart from that, what we have done, I'm going to talk about two scenarios. One is the clinical care, one is the non-clinical care. I'll start with the non-clinical part of it in the hospital. A lot of pain points are there from the patient side if you go across the country and look at the healthcare service providers' performance. So looking at all this, we did our own analysis. We did the patient feedback and voice of customer kind of analysis. And after that, we identified their pain points. And at that time, whether it is, appointment, online or digital format, payment, similarly, a patient who is coming is already anxious in terms of their mindset, and they look for as much as information and service from the provider. So we made all this in a digital format. So when they reach the hospital, much before that, they are completely aware that what all the things are going to happen. To get that happen, I'll not keep it secret that, one of the best healthcare provider globally called Cleveland Clinic, and they have a model where they talk about inpatient experience that you need to tell your customer, in our case it is patients and patients relative, that what do you expect during your visit. So we adopted that model and we started keeping our patients before their OPD treatment, that what are the things that are likely to happen with them and what kind of help they can sought from us and how they can reach out to the right person in the right mechanism. Do you know that if I have a patient appointment in the hospital tomorrow, today the patient get the automated voice call and it says that if you are coming, press 1, if you are not coming, press 2. And in that way, press 2 will lead to rescheduling their appointment. So I don't lose out my patient. At the same time, patient, they know that the hospital is, really interested about me and they are taking care of me. The next thing is in terms of the healthcare related information. So we have all this information digitally archive mode. So if somebody is looking for something to do with bypass surgery, they just need to give a missed call in a particular number and they can download the information booklet in the digital format. And these are some of the practices what we have adopted after looking at the best practices from the retail industry and retail industry globally, where some of the big brands have this kind of thing. Whether it is QR code based information that is available in our place. Then a patient comes for admission, whether, one of the major thing we need not to hide is that how the billing process is happening and what it is. So we have made a system, the on-time online billing information is available with them at any point of time. We have made kiosk in hospital premises. They need to go and put their admission number, and then they can get to see the kind of status where they belong to. Like this, you have made several, intervention, even post-discharge, whether it is a home care needs to be provided and all these have been integrated. Now I'm coming to some of the, strategies what we have done. And we strongly believe that more and more empowerment we can give it to our patients. We make them more, independent. And as a result of that, they can manage their disease condition better. And that is the time when we can manage our patients, they can seek medical treatment in a very cost-effective way. So I have just shared some of the, practices what we have undertaken in Hinduja Hospital as a part of our digital process, digital journey, and patient centricity. So over to you.
Yeah, no, thanks. I think it's very important that I think healthcare providers also are in sync with this actually and take measures like this. Now, I think some of the points which I think the speakers touched upon, if I can perhaps, as a link node to the various aspects was, typically pharma companies, all of them have this engagement with doctors. They engage with them all the time. So if all can perhaps throw some light in terms of how this engagement with doctors can be looked at in today's environment to leverage it beyond just the medicine and this making the aware of the new prescriptions, new drugs and all, but going beyond that to what are some of the ways in which now pharma companies are looking in terms of the way they gather information, the way they look at product innovation, the way the engagement with doctors perhaps could be as one of the tools to move beyond this and to address some of the issues in terms of either looking at what the patients need and all. So some thoughts that I could have from the experts here in terms of how this unique advantage that you have with the physicians, how do you see any change happening there? And maybe some thoughts from each would perhaps help a lot here. Starting with, say, Vibhuti, if it's okay with you.
Sure. Let me go first. And just to share that, most of the pharma companies initiated its journey of beyond the pill in the pre-COVID times itself. However, most of these were at a pilot scale or very small scale engagement with the doctors, and then doctors giving these products or services to the patients, to the end consumers. But now these services are taking shape of major platforms. So companies are taking novel approaches, breaking with the tradition of limited direct engagement. So companies are now closely working with providers as well as payers across the care continuum to provide the patient-centric experience. So talking about, specifically doctors. So now no more the doctors are just being engaged by the rep. So there are whole lot of different avenues to engage with the doctors. There are emailers, there are WhatsApp messages, there are, knowledge portals where we disperse so many kind of different things about the real world evidence, the clinical trial data, about the latest journals, publications, about the latest COVID portfolio which is out there in the market. So there are different avenues to disperse the entire knowledge to the healthcare professionals. So it's no more just the rep, while we believe that rep model will continue to stay, but there's a good number of touch points which are there for pharma company to reach out to the healthcare professionals. And touching upon your previous point around the remote locations, so this will also help pharma companies to reach out to the doctors in the remote locations, because digital is a tool where pharma cannot deploy any field force. Now, through digital tools, we can reach out to those doctors and tell about these new drugs, and they can seek those drugs for their patients. So this is one way, and we observed that during COVID times, even doctors struggle to stay in touch with their patients. So they sought for a lot of different tools and services from the pharma companies, and that's when pharma companies partnered with a lot of digital health techs. Talk about the teleconsultation, electronic health records, and all of those. So the pharma companies partnered and helped those health tech companies to scale up their services, and also it helped the doctors to stay connected with their patients remotely. They could manage the health of their chronic patients, manage their sugar levels, do the digital diagnostic, taking example of asthma control test, right? So some of the tests were not available during the COVID, and this is when pharma companies really came in and came up with all plethora of direct patient services, which doctors could extend it to their patients and monitor the health outcomes. So it's, it's spanning across patient education, dosing, adherence, lifestyle support. So it's really not Internet of Things, it's Internet of Medical Things. This is how we are looking at Cipla.
Internet of Medical Things, very nicely put. Sheetal, you agree with what has been said here by Vibhuti, your thoughts, your perspective, and you've seen across geographies also, and I'm also tempted to ask you this question: whether, going by the experiences that you have in India, are you looking in terms of the way your interventions and experience in India can actually help you devise approaches for other markets also. I mean, that's just a side point, but please go ahead with your thoughts.
So on part A, 100% agree with Vibhuti. I think pharma company has to take a systems approach. It cannot be the traditional way of maintaining the engagement with the customers, where we are mainly talking about doctors over here. And at the same time, as I said, and I think I can again come back to, you asked another question on co-creation. I think we are still discovering. So at one point in time in the last 2 years, what has happened is that, and Dr. Chakraborty talked about it, right? How the Hinduja Hospital suddenly had to change. So every doctor has changed, hospitals have changed the ways of their working because of adopting these digital things. But at the same time, there is a digital fatigue that is also setting in. So it cannot be that we keep bombarding doctors with awareness material and a lot about diseases, new things coming all over, and they're participating in as many Zoom meetings as we are, seriously. So we have to come to a level where all of this is optimized. We actually understand it is not only in the awareness area where the HCP needs our assistance. It is actually shadowing the patient journey. How can we help them? So, Dr. Chakraborty, for example, talked about EHRs. Now, big hospitals have already got these systems instituted in their HIS. Now coming to part B of your question. So, can we create something in India which can be taken to the global world? Oh, yes. I am a very firm believer of that, because India, first of all, I think India is at a point in time where we have, it is the tech center of the world. It is one of the most attractive startup destinations of the world, where maximum innovations are happening. And seriously, if something can work in India in the diverse environment that we have, it will be a cakewalk for many other companies or countries to actually take. So I'm really waiting for these innovations. I think it's a topic for another day, but the startup ecosystem of India is so exciting at this point in time that we just have to wait and watch of new services and new ways of handling things that come from India and can be really taken to the outside world. So I'm very optimistic about it.
I think well said, actually, and I totally agree with you. I mean, as people from the news industry, when we go and engage as reporters to when you talk to radiologists, they're sitting most of the time with engineers, really. So I think I'm seeing a kind of blending of sciences happening here. Mr. Fani, your thoughts?
I think Sheetal covered it pretty well in terms of overall span of what we are trying to do. I think
who says that pharma companies compete with each other? I see a great amount of collaboration and like-mindedness here. Yeah, sorry about that intervention. Thanks.
Yeah. So I kind of get reminded of our family doctor when we were kids. I think the doctor knew everything about the patient. I mean, the entire family history in his head, kind of knows you, personally. What I see as a big shift that has happened is the doctors now not finding the time for the patients. They're just too busy. There's just too many patients, and their own attention span going down. And a lot of doctors don't really like it. And add to that a lot of digital fatigue to what Sheetal is saying. I think the place where pharma companies can come in is essentially helping the doctors navigate the digital world as they navigate it themselves. And that essentially is about, it is obviously a win-win when you actually, like to what Sheetal was talking about, EHRs, a bunch of data points that get generated across the patient journey are now available digitally. Doctor might not know you personally that much anymore, but he at least can figure out from data who you are, can get quickly reminded of the condition and a bunch of other things. And essentially a lot of technology should be about doctor assist, so that the doctor can go back to the most important person in the room, the patient. Right? I think a lot of times the doctors, I think the EHR systems have been called a distraction. They take away the attention span of doctors. But the idea is if we are able to put the digital data and together for the doctors to be assisted, I think that is where the maximum impact is, because the doctors can actually then can spend time with the patient. And I think the second part that you asked about how pharma companies can help, I think a big chunk of an interesting area where I say it is a win-win is the longitudinal patient journey then actually becomes real. A lot of systems, I know Roche bought, for example, Flatiron globally, a company that essentially helped them get a longitudinal understanding of the patient from data, right? I think that is the kind of work that you would see more and more when the venture capital money feeds the startups, helps them innovate. The speed of that innovation essentially, is good for everybody. I think it's good for everybody because the benefits of that will spill over into the overall ecosystem. I think the role for us is, can we be a great orchestrator? Can we be, as people who understand the doctors and their conditions as well as the patients from a product perspective, be the people stepping up and orchestrating this journey for the patients? I think that's the question in front of us. I'm truly excited to what Sheetal said. I'm really kicked about what's in store for the industry, government, startups, and the corporates coming together. I think there is very, very exciting times ahead for all of us.
That's really very nice to hear. And Mr. Chakrabarty, you again, any thoughts on whatever has been said so far? And we now, just to the concluding part, if your observations on what you've heard so far, anything that you need to add, and finally, if you could also, as a takeaway for the listeners who are listening in and viewing this, what would you say as your priorities? And Mike, this question is actually to rest of the speakers as well, as what you see as your immediate priorities. There's a whole gamut of things that you need to be doing in this space. So if you were to prioritize, what would we say in the year from now, something, what would you see as immediate priorities in your respective domains, if you could say? If I can begin with Mr. Chakrabarty, your observations on any of these and your immediate priorities in a couple of.
So my observation, I'll go with one statement was Ms. Sheetal has made, that doctors are becoming digitally fatigued. So there was a study conducted by one of the big four consulting firms, and they have shown the result that just before the onset of second COVID wave, doctors were interviewed in Tier 1 cities and metro cities and were asked, will you prefer to continue with this online business, what you have currently and what you have experienced? To my surprise, I understand 53% of them have told, yes, this is the way we should go. And 17% of them have told that, yes, we'll prefer to continue. So close to 70% had an affirmative answer to say that digital is the way. When the same question was asked to the patients, because in many cases they are not from the same place and they have done teleconsultation with the doctors from other cities, that what is your future? Would you like to continue with this? How do you feel that it is comfortable for you and you are getting answer to the your queries, and you're getting comfortable with your doctor's treatment? A significant number of patients have told that, yes, I feel this is comfortable because I can get it done from my home.
Mr. Vibhuti, your thoughts on what you see as the immediate priority for pharma companies overall, and if you have anything specific for your company. My same question would be again for Ms. Sheetal and Mr. Fani, and we end with that.
Sure. So one thing, which I think we didn't talk about is about the policy. It's also going to be very important. And existing regulations and evolving ecosystem really needs the pharma companies to connect all of that patient data which is sitting on different systems, and there's no unique identifier to integrate it across e-pharmacies, your diagnostic, as well as prescriptions. So how do our policy makers enable us to integrate that data while preventing the patient privacy is very important. So that's gonna be a key disruptive issue which needs to happen from a policy standpoint. So there are different companies entering from outside of India. So consumer giants are trying to innovate the entire healthcare setup. So how pharma companies collaborate and help in scaling up of these digital health solutions will be key as we continue to evolve on this journey. Last but not the least, patient engagement is not just for physicians anymore, and pharma's movement to master end customer engagement is now.
All right, Ms. Sheetal, your thoughts?
Sure, so I'll keep it brief since you asked about what is the immediate priority for a year or two from now. I think as an oncology company, the first and the foremost will be to see how to engage digital tech to ensure that the awareness for cancer increases, so that people are able to catch the early warning signs and are able to reach the right point to start the treatment in time. I think that's for the patients. And of course, it also includes that we continue to educate the patients and help them during the journey that I spoke about earlier. And the second thing would be actually make our whatever little contribution we can, to get the entire ecosystem ready for digital. So just using, as I said, this is just, it's got mainstreamed, but this is only the top of the iceberg that we see is usage of digital apps. It's all about the mindset. Even though we speak about data, I don't think data is the first and foremost thing that comes to a healthcare provider's mind, for example, how important it is to record data as a habit. And that will not only, ensure that the recording is correct and we learn more and more from the insights and data, but also to pull India up on the domain of being able to figure out how treatments are reacting differently with different ethnicity, for example. At this point in time, since there is no data collection that is even happening, forget about being collated at a country level. I think as a population missing out on a lot of very interesting medical discoveries and interventions that can come out of India. And I think that's where we would like to assist the HCPs in also putting India on the map as far as, research, the worth of real world data is concerned, as well as conducting trials in India.
So hope we will see more trials happening out of India, I think, because I think that will also play an important role, whether it's in terms of giving the medicines away and
yes,
getting the people involved and the cost issues, all of that will get addressed.
Yep.
Mr. Fani, your concluding remarks, and we end with that. You get the last word here. Though there are ladies here, I'm giving you the opportunity.
That's a lot of pressure, but yeah, I think for us, I'll keep it brief, Kumar. For us, I think one of the most important priorities right now is to spend more time mapping and understanding the patient customer journeys. I think we have all of us in the industry and we personally feel that we need a much deeper understanding of the patient journey in a lot of therapy areas. So quite a bit of work and priorities on mapping the patient journeys much more strongly. The second we have realized is a very strong focus on digital capability and capacity building. I think the understanding of what digital means and what digital means to us specifically, is a big gap right now, and that's something that we would intend to fill in the next 1 to 2 years, both from capability and capacity. The third one is about investments into our own platforms. We've talked about SWAS, and also into our partners. I think that's going to be the third biggest priority. That's the way we would meaningfully engage a lot of partners, startups, to ensure that we get the best out there from an open innovation perspective, because we can't do it ourselves. We can't do everything ourselves. So these will be the three big ones: patient journeys, capability and capacity in digital, and investment into the platforms and the ecosystems. I think these will be the three big things that will happen. And of course, a meaningful engagement with the government on the NDHM, would be the last word I would leave there, Kumar. I think we're all looking forward to have some good conversations there as well.
No, I think meaningful engagement there is important, and the investment firmament in times of a pandemic, when there are more worries in terms of whether I should invest or not, is a very good thought to leave on also. So thank you so very much, each one, for your time. Really very insightful thoughts in whatever time we had. Thank you so very much again.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, Kumar, and the panelists for that vibrant session. Let's now move on to our next exclusive cloud session by Cindy Mackey. Cindy Mackey, VP, Industry Solutions and Value Management, Cloudera. Over to you.
Good day, everyone. I'm Cindy Mackey, Vice President of Industry Solutions and General Manager of Healthcare at Cloudera. Cloudera is proud to be the technology partner for this year's Financial Express Healthcare Conclave. Today, I want to share with you where Cloudera is helping in the healthcare industry and also specifically around the data revolution in healthcare. Cloudera has the opportunity to work across the entire healthcare ecosystems from both healthcare plans, health insurance industries to healthcare providers in working with public healthcare and also working with healthcare IT organizations, as well as in the life sciences industry. Cloudera actually focuses on a hybrid data cloud, and that is about bringing together any and all types of data. We firmly believe that data can make what is impossible today possible tomorrow. We empower people to transform complex data into clear, actionable insights and do that in a cloud-native platform around the data lifecycle, whether it be in your data center or in the public cloud. So let's take a look at kind of and summarize some of the events that happened at this year's HIMSS 2021. Again, virtual event this year. And there was 5 key takeaways. And if I think about where we are as the healthcare industry, and everyone on the attending the conferences is living with some of these challenges, is how do we help our healthcare workforces, both from dealing with cases to dealing with the uncertainty, also making sure that both patients as well as our employees are safe. We're also looking at what's the role of healthcare data. And that what we're seeing from a healthcare industry is data is playing a more and more important role. And also at HIMSS this year, it was also talking about patient journeys and how to we as an industry be even more passionate and empathetic beyond kind of just our current state. And also, how do we do this both in a secure fashion? How do we constantly improve our operations? And also, how do we leverage some of the emerging technology, whether that be, health IoT, looking at AI, looking at machine learning. But what I guess the key takeaway for me, especially since we focus on data and analytics, is how do we actually make sure that we have the full potential of data, that it's representative of the population, that we're dealing with data that's been that's relatively clean, that we can have data interoperability, and also can we provide transparency across the healthcare ecosystem. And I think it's very important that looking at data, that we have to deaggregate the data, understand who's benefiting and who's not, create awareness, and also data helps us improve equity within the healthcare ecosystem. So if we look at the type of data that we're dealing with, the data landscape is becoming more complex and more interconnected, whether it's patient data from clinical trials to actual healthcare records to information coming from devices, it's research information. The key is how to look across the ecosystem. How do we extract the data? How do we link it? How do we make sure that it's we're providing privacy as well as data security? And in that, Cloudera has the opportunity to help organizations bring together any type of data within the healthcare ecosystem, whether it's environmental data, it's the social, it's the economic, and bring it together and look at the type of analytical methods that you may want to do. And to do those analytical workloads, whether it's in a hybrid data cloud, if it's on-prem, really getting that visibility, getting the security, getting the governance and getting the data accessible, making sure that we can actually use it to enable some of the top industry use cases, whether it be from a being able to predict and prevent diseases, to doing research, to also looking at some of the supply chain and logistical and availability of equipment, both in the hospitals as well as inpatient home health care. So some of the top use cases where, and digging down a little bit deeper, is where we're seeing data and analytics having a role, and where Cloudera is actually helping enable. And that's around patient engagement, looking and understanding even at the attributes of the physicians, being able to bring down and analyze data from the entire population, to getting very prescriptive about that data, and also being able to help drive down what some of the costs of data accessibility are, and to be able to perform healthcare more effectively and efficiently and without bias. And by doing that, looking at predictive analytics, both in the clinical situation as well as in the telehealth, being able to do home health care. We're also helping organizations by just extracting and sharing information across the ecosystem, whether that be data that's unstructured to structured data, looking at the wearable information, looking at health IoT, and that both at the patient side, at bedside, and also just on physical assets within the hospital and the healthcare clinics themselves. We're also having the ability to help organizations look at image information, being able to look at diagnosis, and then also just dealing with the level of data, the data variety, that deep data landscape that we're dealing with. So with that, I want to share a few customer examples where we're helping the organizations. This last year, helping Rush University, which is a large healthcare hospital system in the Chicago area, at the forefront of the COVID crisis. They were really struggling with how do they get better accessibility to their information, to their data, that they could share both with the physicians, the caretakers, to also to the hospital administration, and understanding what data, what equipment was available. Could they actually understand patient healthcare records? So getting that real-time patient information, being able to merge that information, and they leveraged our data flow capability, and merge that real-time information with also historical patient healthcare information. And then also where was the availability of actual PPE equipment within the hospital to help them identify current caseloads as well as shortages within equipment. Next, last year, Discovery Health, a healthcare and health insurance organization in South Africa, wanted to give their current members better insights into their potential for contacting COVID. So they were actually pulling in data from both hospitals, healthcare providers, and building out a kind of a data pipeline per se with our Cloudera machine learning capabilities, pulled together over 900 different attributes, helping to identify at-risk members. By being able to do this in a more precise fashion, they were able to reduce some of their the COVID mortality rates by an attribute of about 60%. This year, I'm very proud to say that the National Bone Marrow Donor Program, or Be the Match organization, has been leveraging Cloudera to bring together profiles of over 44 million bone marrow, both candidates as well as donors, to actually match the information, being able to get better insights into the research, looking at the real-time information, They're doing this both in a hybrid cloud-based environment where they have certain data that they're analyzing on-prem, and then also being able to bring in new information. They've added well over 325 new donors to the program, and have been able to help benefit over 6,600 recipients this year. ClearSense and Macquarie College is an organization that we've been working with. That ClearSense is both a customer and a partner, and they've partnered with Macquarie, which is an organization that is focused on the attributes of getting research information without having to have some of the deep data science skill set within their organization. So ClearSense's application, which is built on top of Cloudera, is bringing together and has built an analytical platform that brings in data from all types of data sources. They are dealing with data both within the hospital as well as research data. And using the data science workbench capabilities have been able to help physicians more quickly and precisely look at patient care, and also understanding whether or not there was a potential for bias in the data. And lastly, being able to work with a pharmaceutical company that has been bringing data that has been sitting in kind of data silos throughout the organization, both from a clinical trial perspective, as well as looking at real world evidence data. We've been working with them with establishing a more robust, data warehouse in the public cloud. They're bringing in real-time streaming information from clinical trials from the wearable devices, and also being able to alert the attending physicians as well as caregivers on any adverse reactions by the patients or those in the study. And just really want to thank you for the opportunity to participate in this year's event. My contact information, would love to be able to stay in touch with you. Also reach out via LinkedIn, and I'll leave you with a couple of assets about Cloudera and how we're helping in the healthcare industry. Thank you, and I hope you have a wonderful event.
Thank you, Cindy. The topic was highly relevant to the digital healthcare industry today. Before we proceed, let us thank our partners. Presenting partner Optum Global Solutions India Private Limited, powered by Eka Care, co-powered by Navia Life Care, technology partner Cloudera, supporting partner Ecnamed, and associate partner Kefid. We now move on to our last panel of the day, creating value-based care through big data. With Ayushman Bharat digital mission coming into place, need for creating value-based care models through big data is reinforced more than ever. Big data in healthcare can help enhance patient outcomes and lower costs considerably. There is an urgent need to bring about actionable information out of the huge data sets. A well-informed healthcare analytics strategy is important in finding valuable insights within large piles of data. And our panelists are Arvind Sivaramakrishnan, CIO, Apollo Hospital Enterprise, Mithali Biswas, CIO, CK Birla Hospital, Shivankar P., Senior Director, Information Technology and CIO, Manipal Health Enterprise Private Limited. Our moderator for this session is Sanjeev Malhotra, CEO, NASSCOM, Center of Excellence for IoT and AI.
Hello, everyone. Welcome to the esteemed panelists. Today's topic on the digital healthcare. We all are aware how important digital healthcare has been in the last couple of years. It's found its way in many different parts of healthcare, be it in diagnostics, be it in patient care, be it in predictive health. And there are areas there is a lot more to be done in the coming years. While we have made a lot of headway, in providing healthcare, which is helping reduce the costs, which is helping improve the patient care. Also providing access in the remote areas, through some of these new digital inventions, or I should call new digital devices, So we have seen the impact of these devices in multiple ways in different parts of the healthcare delivery. One big part, which is yet to be where we need to do more is on the big data side, where we believe the benefits of having data is going to improve healthcare delivery and the predictive health in particular, and a couple more areas. So we are going to be focusing more on how actually, while we all understand the advantages of big data, we want to spend some time talking about how actually to use this big data to the benefit of patient care, how to adopt it, how to bring it into the real life usage, if I may say so. And we are delighted to have the three practitioners of the healthcare who are actually part of the healthcare delivery system, who are part of the healthcare delivery organizations. So with that, I think I'd like to invite Arvind to talk about the topic of how actually we can use the big data for our benefit, and how can we consume it and make lives better for the delivery or people receiving the healthcare.
Thank you, Sanjeev. In terms of, I don't think it'll be wrong for me to say that we are drowning in data. But with all the data that we have, translating that into actionable insights at point of care, I think that's really the power of what we can do. So the first part in terms of how can we use big data, it's not about whether we are convinced that there's value in it. There is definitely value in it. Now the question becomes, how do we start becoming effective? The first thing definitely goes into defining the problem statement. What is it that we are trying to derive, and what is it that we can do to ensure that the data that we are training this algorithm for is accurate? And that means that ensuring that data is not just feeding the constant learning of this algorithm, but also this data is weeding out all those avenues of false positives. So training the data and making it as effective. It's really important, again, and I stress on it, on defining the problem statement, so that what we do with the data and the translation of that data to actionable insights is really solving a problem statement. Sometimes we get into a very overarching statement, and that means that the data, when it returns insights, is going to be rather vague. And when something is vague, you're not going to really get actionable insights out of it. So making the problem statement as precise and having as many problem statements as possible. So if that is the way in which we formulate, we will really be doing it at point of care. The second aspect in terms of consuming big data at all aspects of healthcare delivery is to ensure that these insights are embedded into the work process. It is not like somebody is going to do their work and somebody is going to come back and do insights. That's more research and development, where you will be looking at a process and then looking at it. But if you're looking at bringing that into healthcare delivery, into active healthcare delivery, then it is extremely critical that we imbibe that into every work process, and every work process in terms of ensuring that this insight enables them to be the best, reduces errors, or in fact eliminates even the possibility of errors, and gives them all options for treatment or the next aspect in that process flow. And again, I'm saying treatment or process flow so that it's not limited to the clinical areas of use in healthcare. It's all the entire healthcare delivery, the supply chain, the human capital management, the revenue cycle, the service management, all those aspects. Now, keep that a process flow, giving them insights of what are the options as it relates to the situation they are in. And this means that healthcare 24/7, 365 can deliver its best possibility. So I think we need to bring all of this together and ensure that we are robust on delivery.
Thank you. Good point. I think clinical usage is not the only use of data, because all other things also add to the patient care. Some of them directly, some of them indirectly, but they're all adding to the overall well-being and better delivery to the patient. No, great point. Mitali, can you share your experiences or thoughts on what you think on the consumption of big data?
So, data is the new oil. All of us know that. And I think, we have not yet realized the power of data in healthcare. I mean, compared to other industries, healthcare has been far behind in terms of digital adoption. So the pandemic has, of course, accelerated it. And we have started capturing all data. I think before, even the data capture was not happening. So if I take the example of my hospitals, I wouldn't say we are capturing 100% of data. And when I say capturing data, it is all, as Arvind said, it's clinical, non-clinical, operations data, patients' EMR data, EHR data, diagnosis data, radiology data, even supply chain, drugs, everything. So first, I think the data has to be captured. I think that all of us have started, but we are still, there's a journey to be covered in terms of reaching that 100% adoption, because the change management part of it is not easy in healthcare. So that has to be done. Once that's there, it has to be probably there. The technology, of course, comes in where you capture all of data and, store it and put it in a manner so that it can be, consumed. And of course, as Arvind said, it's very important to understand what we want to do with the data. Just because big data is there, let's, do something and not kind of dive into it and try to do everything with it. So probably, what we are trying to do is putting it in buckets. So we have a bucket for patient experience. There are few use cases under it, which we want to probably target. Then there is clinical excellence, which would help our clinicians to make, better decisions. And then there is operational efficiency. So there, for example, we would like to get insights so that the hospitals run efficiently. There are seasons of hospital, there are loads, there are, periods where the load is not much. But then how do you make the entire, operations efficient? Make sure that there is adequate manpower. Make sure there's enough data in the hands of your people so that they can make decisions faster. So all of that has to come from the power of data, and it has to be, of course, integrated. So if I come to clinical excellence, with the power of data, it should support my clinicians to provide better care. So all the information should be there so that the diagnosis is better, even the care plan is better. So I can very quickly diagnose what the patient is going through, and then also give the treatment very fast. So that's how, we should be probably is where the healthcare is heading to. And also patient is the center of everything. As we have seen in other industry, with the consumer at the center, I think the way the patient is expecting from healthcare, that's also changing. So they are also expecting a better healthcare, be at anywhere, be at home, be at hospital or anywhere, they are expecting a better healthcare. And that's again possible because we could be capturing a lot of remote data, all the variables part of it, or even in the hospital, in the ICU, we generate a lot of data from this equipment. So all of this data, the IoT data coming in, I think that also adds a lot of value in terms of capturing those data and getting some insights out of it. So yes, I think though we have a far way to go, but the data capture has started and it has the potential of making a difference in patient experience, clinical excellence, and also operational efficiency of the hospitals.
Great. No, I agree. I think that's what Arvind was also saying, and you're saying the same thing. We should know our targeted problem also, and that way it's easier to tune your algorithms so definitely there is a lot of room to do more. But I think you said awareness is there. Everybody understands there is the application of these things. And Shukumar, maybe you want to share. I mean, where do you see this coming? Or this thing. How fast you see this getting adopted, and your experiences in your hospitals?
Sure. Already Arvind and Mitali told the approaches and nitty-gritty of the big data and how healthcare industry is now very keen to harvesting all this data. So already we discussed, but the basic motivations, what I think, like as per our topic is like value-based care. What is value-based care? We mean to say where payment to providers is paid according to the level of your health outcomes. It should not be like patient instead of deliver amount. It should not be against the deliver amount. Once it is there, once this is there, and another thing is your digital culture in your organizations. So these two things will intend you have a good quality of data. Now we are getting a data in different ways, structured data, unstructured data, and there are a lot of talk. We generally talks about all artificial intelligence as a tool to harvesting all those data. But there are a lot of gaps in our data quality, basically. There are a lot of manual processes are there. So small and inconsistent data set we generally receive as a whole systems. So patching up all those things and getting a quality of data is a big challenge for IT in healthcare. And, now kind of not in structured data means like as for example, your EMR systems, many people are doing just scanning the documents. So this kind of data, when you are putting some sort of tools over there, the efficiency of the tools matters. So when you are taking a decisions which will lead you kind of advanced patient care, operational efficiency in the systems, reducing the patient's cost for the care treatment, then this efficiency matters basically. How perfection is your tool. Otherwise, it is very difficult to get proper outcome, right? So there are a lot of tools available in the IT industry also nowadays. Now people are working on rigorously. It is always encourageable, but we have to see the perfections of that tool, so that when we are harvesting this data or when we are creating some sort of algorithm on those data basically, then it should be a perfect outcomes for the patients. So in particular my organizations, there are different disruptive systems out there because two organizations merge each other. This is a typical problem statement for data harvesting for the IT systems MHPL. So now we are getting a different kind of data architecture itself. So that is also a challenge for us. So not only kind of unstructured data is a challenge. You have a structured data in different format. That is also a challenge for us. So, but definitely big data harvesting only give you the benefit of in all matters to the following components. One is like, as Mitali told, is patients, definitely they will get a better service with low cost. And two is providers, they can give you the higher services, provider efficiency. They can introduce the operational efficiency in the systems and better patient satisfactions also. That's also matter nowadays. And third component, we can talk about the payers also. Because from payer side, if you provide them a good data, there is a risk optimization of the risk and few claims. So they'll be happiest in that case. And like Arvind told, is suppliers is another component to be affected if we have a good data quality, because aligning prices with patient outcome matters basically for this thing. And overall, as a society will have a lower cost service and healthy systems basically. So it is not only impact organizations, it will impact as a whole as a society.
Absolutely. I think totally agree. I think one of the points you made is on the quality of data. So during your talk, you were saying about quality of data.
Yeah.
Arvind, where do you see the challenges on this? While we all agree this is going to have benefits across the board, of course, quality of data is very important. Unless you provide the right quality, outcomes are going to come out equally proportional to the quality we feed in there. What other challenges do you see from your side?
When you look at challenges, the first part you'll have to look at is a disciplined transactional capture. While we expect outcomes, when the input is not there, then obviously the entire algorithm is going to be skewed, and thereby it's not going to be of any use. So disciplined transactional capture. And disciplined transactional capture immediately calls for a well-defined process alignment for all types of scenarios by which that particular process flow can be entertained. So that is the next part. I think when it comes to harnessing big data is putting the right talent of the functional expertise. Sometimes it could be clinical experts or the non-clinical experts in terms of operational areas, along with those who understand the data, and along with those who are going to be the data scientists who are going to mold the data to form those algorithms and the learning patterns. I think bringing this resource pool of talent to make harnessing data is a very, very important part. And I think it's a pretty big investment. It's not a big investment on cost, but it's a big investment on talent. And thereby this is going to take its logical course of time. The next aspect that I've seen interesting is expecting instantaneous gratification from big data analytics. It is going to take its logical course of time to train, weed out the false positives, and ensure that it is consistent so that it can be put at point of care. I think giving that level of planning and expertise and making it such that it is the fourth aspect of challenge, which people always fail to look at, is how do we ensure that it's constantly learning. It's not a one-time activity. Just don't do it, see some results. That's a proof of concept. How do you ensure that this lives forever? So that sustainability of data and that sustainability of fine-tuning the algorithm is also an aspect on harnessing big data. I think all these will have to be given due attention. One is not more important than the other, but we look at all of this, I think we have some consistency.
All right. You said many things on that, and that tells us, it is going to take some time before we see the results. So before I move further to Mithali, tell us something low-hanging things we can get out of it, just to get a feel of, okay, this is the area, not just low-hanging things in terms of exact problem statement. I'm asking you, what steps can we take to say that, okay, let's start with this and this will get the ball rolling? Obviously, is it hospital entirely who will do it? Will hospitals have to collaborate with some people? Where do you see that going?
One, in terms of problem statements, look at prescriptive algorithms. Prescriptive algorithms are well documented, well regimented. You can always start with that. And this can be done by your own hospital team. If you want to partner with somebody else, that is fine. But prescriptive is something where at least you have a defined and well evidenced problem statement. So you're not venturing into the area of gray areas of whether this is going to be acceptable practice or not. I think start with that and start with area and definitely pay attention to the areas of strength of your data, not areas of strength of the outcome, areas of strength of your data, and start from there, work on prescriptive, then from prescriptive work on predictive algorithm. From predictive, then you start getting into the larger aspects of cognitive algorithms. But I would say start small, start simple, and start in well-defined areas.
Got it. So Mithali, where do you see the challenges in this actual practice and bringing this into the real life? What have your experiences been on this?
So one is, making sure that you capture the right data and the complete data. It should not be half-baked. That, for example, if you're talking about a patient, you capture half of the data and you don't capture half of the data. It doesn't help. It's going to give you a wrong result. So one, making sure, and that's going to happen through very rightly, as Arvind said, by training your digital workforce, by having the right processes in place and across the hospital, capturing the right data and making sure that you capture the complete data. That's one aspect. Second, I think there also needs to be some data standardization. And probably the government also has to play a role there, because right now there is no data standardization in the healthcare industry. I mean, the way I capture data may be very different from all the other hospitals capturing data. And if we have to realize the power of data, some data, standardization has to come in. And with the digital health, mission, the blueprint, I think there are certain sections there which talks about, FHIR, for example, which talks about interoperability of data. So that has to come in the industry, with some clarity, so that people are clear, what to capture and how to capture. So, the power can be realized more. Otherwise, I go as a patient, go to one hospital, it captures in some way. I cannot share it with other hospitals, so that gets lost. So in order to have that, I think some kind of data standardization is needed. And third, I think something on the lines of security and compliance, because right now, nobody is very clearly aware what are the security compliance needs. For example, I as a patient, I don't know, which data should I share, which I should not share. Even as a hospital, with the consent of the patients, what I can store, what I cannot store, what I can mask, what I should not mask. So there's a little bit of gray area, which is not very clear, I would say. Though I think the efforts have started from the government, but a lot of clarity, I think, needs to come in these aspects, so that, because as we move forward, we are going to capture more and more of data and use it. So unless there is clarity around compliance, the standardization, the sooner we get the clarity, I think better. Because then we can realize the power, even in a better way. So those are the challenges, I feel.
Shiv Kumar, what has been your experiences on this? On where do you see this happening, and where do you see the bottlenecks, and how do you see we can address some of these as well?
Arvind covered almost major challenges. I must add 2 points. One is like, I can give you the examples. In a particular specialty, there are 2 doctors. One doctor is a very good practitioner, and one is a little bit lower practitioners. So when you are implementing e-prescription kind of things, the volume which doctors carry more, he is reluctant to enter all the values on your e-prescriptions, because he wants to see 50 odd patient in an hour. The person who is looking after 20 patients in an hour is very good enough to capture those data. So this kind of gap we need to plug in first. Somehow we have to think how we can manage this kind of practices. Number one. Number two, we are hospitals, we are last 13, 14 years old hospitals. So maybe there are certain inputs, like another example I can give you in ICU, infusion pump. Maybe many hospitals runs infusion pumps in very old model. Now, when the vendor is coming, they are not able to plug in those data. They can't capture those data into their patient monitoring systems. So there is a gap. So how to plug that? So not only the hospital, the vendor who is helping in a medical devices also, they should think how we can capture those data from their R&D sections, research and development sections. So there are both ways challenges we are facing to capture this data.
Right. So, I mean, one of the things that you talked about standards, Mithali, is another area in healthcare is regulations also. I think regulation around data, I mean, if you have to make one recommendation also, how do we speed it up? I mean, as part of NASSCOM, even I am looking at, how do we make some open data hackathons, how do we make this thing come into the mainstream, even if it doesn't have, not everything translates into a product or a actual use, but the culture of big data, how do we get the data out to people and say that, hey, demonstrate small things, big things we know will take time, we all understand why. I mean, it's always a gradual process. There is a learning, there is a issue of regulation, there is issue of standards, there are lots of issues. So I'll just say, if you have any recommendation to make, on this front, what would that be? And with that, I think that will be our last round. And so let's keep it short for a minute each.
Right. So I think the government should play a critical role, because we as Indians, we don't do things unless we are, pressured to do it. We don't do. I mean, that's a reality, right? Because there's so many challenges and problems to cater to. I mean, just if you say that, you have to do it, come on, let's do it, there is value, nobody's going to do it. Because the hospitals are firefighting day in and day out, Sanjeev, and I mean, we have to understand that. So I think the government plays a very critical role. There has to be some regulatory pressure, some compliance pressure that, boss, you have to do it. Only then we will do it. Otherwise, we are not going to do it. That's what I feel. There has to be either some kind of a penalty or a tax benefit, something, which the way we Indians work. I think that kind of a thing has to be there. And I think, of course, probably the technology team understands the value. A lot of awareness and education is needed on the business side also. I think that's still a bit lacking. They don't understand, what can be out of it. We probably understand it much better, but I think that education is also needed. And I think that's where probably, NASSCOM can also play a role by, educating those people through different seminars, conferences, talking in a language that they understand rather than the technology language.
And that's what exactly I'm trying to do, I don't want to be again talking with PowerPoint slides. I want to go and say that, hey, this is what we took. This is what it came, and this is what it make a difference. That has got a far more impact than, other things. Talk is easy. So that's where I'll be looking at some of your guidances and inputs on that. How do we make that happen? If any of you want to add last closing comment by you, Arvind and Shivkumar, we can.
Yeah, definitely. Yeah, Mitali told correctly, actually. Until unless government step in, it is not possible in India at least. And if the culture is changing, like USA, UK culture, like your entire healthcare system is operated by your peers group, basically insurance company, and then it can be possible a bit. But government need to be stepping totally. Otherwise, it is not possible in private sectors.
No, but how about incentives? There is incentive to improve patient care costs. Let's say the cost comes down by using certain things, right? So that's an incentive, I would think. Yeah. So Arvind, any last thoughts on it?
I think if it is channeled on outcome-based initiatives, I'm not going to completely say that the government will have to step in. I think that's where I'll disagree with my colleagues. Because the government has got enough to do in terms of running the nation and the larger aspect of public healthcare. And in our country, that's a significant burden on healthcare, and it's important to us. But I think if we keep it at outcome-based and challenge both the public sector and private sector to publish outcomes, now automatically outcomes is going to create value or diminish value. And thereby you will start getting into some sort of a pricing that is value-based, and pricing that is also logically baseline, because we want to keep costs controlled, costs logical. I really don't want to say costs low, because it costs what it costs to deliver a service and maintain that service. So costs in a logical level, so that we are not out of proportion for the service of what healthcare needs to do to a land of 1 billion people. I think we need to, so I would strongly advocate outcome-based care, so that outcomes can be captured and people are held accountable to outcomes, and that is public sector and private sector. This is not just a private sector game. Public sector has to be there. Only then healthcare in India will grow to the extent. Growing one sector is not going to be beneficial for the citizens or the economy.
Great. No, absolutely right. I think outcome-based problem solving and approach, I think, is definitely going to get us better results and more targeted. And definitely government can play a role in regulation. Right now, making data available is not that easy, So government has got a role there. If not creating actual data sets to solve the problem for us, but I think we may have enough incentive on our own to put effort. And with that, I think we'll come to end of this good session. And I'll also urge people in the audience to come out. If they have any suggestions, please reach out to us, share your ideas on how we can bring big data problem solving into the mainstream, even if in a small way, and we'll continue to strive towards that, and given that we already have a pretty robust IT industry and AI and analytics stream becoming one of the very strong, it's a sort of becoming a forte in India. we want to ride that thing and be a leading nation when it comes to adopting some of these technologies for the benefit of healthcare delivery. So thank you very much, all of you, for your valuable time. It was good talking to you, and I'll continue to remain in touch with you to follow up on some of these good topics we discussed today. Thank you very much.
Thank you.
Thank you so much, Sanjeev, and our panelists. Now playing a short video from our sponsor, Optum. By the way, I'm hoping you all are sharing your learnings on social media using hashtag FE Digital Health and hashtag Financial Express, also tagging us at Digital Health Conclave.
Health is an important part of life. It impacts relationships, careers, how we reach our goals and dreams. Managing our health should be simple and effective, with smart, seamless experiences that connect individuals to the right care and support. By drawing from broad data sets that create a foundation for deep, insightful analysis, applying experience and expertise to deliver care plans that improve health, providing personalized services targeted to the individual, addressing physical, mental, and financial needs, reducing costs and delivering healthier outcomes. By meeting each individual where they are in their healthcare journey, by helping them to know how to approach healthcare challenges, what issue to tackle first, and where to go for help, people are empowered to take ownership of their health. And good things happen. When the healthcare system is easier to navigate, barriers collapse and care becomes accessible. And as clinicians, employers, health plans, and individuals are guided toward the next best action, costs decline and results improve. At the forefront of personalized, connected healthcare is Optum, so people can focus on what matters most.
And that's a wrap for our day one of the event. We will meet you tomorrow for exciting sessions. Do not miss our special address by Dr. Soumya Swaminathan tomorrow. See you soon.